okay. Yeah. Okay. Good morning and good afternoon, distinguished representatives, friends, ladies, and gentlemen. I have great pleasure in declaring the 72nd session of the World Health Organization Regional Committee for the Western Pacific open. Distinguished representatives, similar to last year, 2021 has been a very difficult year. As we did last year, I would like to propose that we begin our proceedings today with 1 minute of silence for all those in our region who have lost their lives during this pandemic. May I request everyone to please rise for a minute in silence as we pray for the eternal repose of our brothers and sisters whose lives have perished during this pandemic. Thank you very much. I know we will hear more about the region's ongoing response to COVID-19 later today during the Regional Director's address. Colleagues, as all of you know, this session of the Regional Committee is rather unusual. Last year, we met virtually. And this year is the first time we are meeting in a hybrid arrangement. Accordingly, we need to adopt special procedures to regulate the conduct of this meeting. Draft special procedures were prepared by the Secretariat and circulated to the member states for consideration and comments, together with the invitation letter dated 5th of August this year, and the revision in the note verbal dated 8th October. The Secretariat advises me that it received no comments or objections to the draft special procedures. Accordingly, unless there are any comments from member states, I propose we now formally adopt the special procedures. No comments, and if there is no objection, it is so decided. Honorable delegates, next I would like to report to you on the credentials for the meeting. It is my pleasure to report to the Regional Committee that 31 members have submitted credentials. In accordance with special procedures we have just adopted, I examined these credentials and found them to be in conformity with the rules of procedure of the Regional Committee. Therefore, I propose that the committee recognize their validity. If there are no objections, it is so decided. We now move to the next agenda item. And now for my address as the outgoing chair of the 71st session of the WHO Regional Committee for the Western Pacific. To our honorable ministers, distinguished representatives, Dr. Takeshi Kasai, our regional director, the representatives of United Nations agencies, intergovernmental organizations, and non-governmental organizations. Friends, ladies and gentlemen, it is good to see you all at this 72nd session of the WHO Regional Committee for the Western Pacific. We meet again this year in difficult circumstances as the COVID-19 pandemic continues. In our region, more than 9.2 million people have been confirmed as infected, and sadly, more than 126,000 people have died. We will hear more about the regional COVID-19 situation and response later this morning, following the regional director's address. We will also be joined later today by the co-chairs of the working group on strengthening the WHO preparedness and response to health emergencies. It is now my great pleasure and honor to be able to report to you on some of the progress that has been achieved on the other major agenda items we discussed last year. First, the Regional Committee last year endorsed the Regional Action Plan on Healthy Aging in the Western Pacific, which sets out a vision for healthy older adults to thrive in and contribute to society. We sometimes call this turning silver into gold. Over the last year, the WPRO has worked with member states to implement the action plan with a particular focus on advocacy around planning for early action, the development of technical materials, and fostering multi-sectoral collaboration in support of healthy aging. As the COVID-19 pandemic has had a disproportionate impact on older adults, the WPRO also provided technical information and support for member states to identify, reach, and protect older persons from COVID-19, especially vulnerable groups who are at most risk. Second, the Regional Committee endorsed the Regional Strategic Framework for Vaccine, Preventable Diseases, and Immunization in the Western Pacific. This framework aims to expand the scope of immunization, maximize the benefits of vaccines and immunization programs in the region, and achieve and sustain elimination of additional vaccine-preventable diseases beyond those traditionally targeted. And through these actions, we aim to make the region free from vaccine-preventable morbidity, mortality, and disability towards 2030. And over the last 12 months, the Regional Strategic Framework has also been used to guide both WHO and member states' efforts to roll out the COVID-19 vaccines. Third, the committee endorsed the action framework for safe and affordable surgery in the Western Pacific region. As you know, surgery is required in 30% of all hospitalizations and is now increasingly recognized as an indispensable component of universal health coverage. And to advance implementation of the framework, member states WHO and partners are working to identify gaps in surgical systems, to address issues regarding pricing and quality of consumables, and to upgrade the surgical capacity in countries around the region. Excellencies, we have another busy few days ahead of us. Although in different circumstances to previous meetings, I look forward to working with all of you through this innovative hybrid format to advance our region's health agenda. Excuse me. Thank you to the city of Himeji and the government of Japan for hosting us in Himeji this week and for all of your great efforts to prepare for this meeting. And I would like to thank last year's Vice Chairperson, the Honorable Minister of Health and Medical Services from Fiji, Dr. Ifiremi Wakanai Bete, and the other office bearers for their wonderful and substantive support. And finally, a big thank you to Regional Director Dr. Kasai and your staff. Let's give them a big round of applause, ladies and gentlemen, for your hard work in organizing this meeting and in supporting countries of the region to respond to COVID-19. Thank you very much indeed. We now consider the next item, the election of new officers, beginning with the chairperson. Are there any nominations for the office of chairperson? Australia?
Thank you, Chair. Australia would like to nominate Japan for the office of chairperson.
Are there any seconders? Cambodia?
And to be elected for the post of chairperson.
Are there any other nominations?
No, ready.
Ready.
If there are none, I have great pleasure in pronouncing the representative of Japan, the Honorable Hiroshi Yamamoto, State Minister, Ministry of Health, Labor, and Welfare, as chairperson. Let's give him a big round of applause. Will the Honorable Minister Yamamoto please take the chair?
Distinguished ministers, thank you very much. And well, I would like to express my sincere gratitude to you all for electing me to the chair of this committee. Well, tomorrow there will be another opportunity, but at that time, I would like to deliver my speech as the new chairperson. Now, we would like to go on to elect the vice chair. Distinguished representatives, are there any nominations for the office of vice chairperson?
ニュージーランド国
Thank you. The New Zealand, please.
The
representative of New Zealand, please.
Thank you, Mr. Chair. New Zealand would like to nominate Tuvalu for the office of Vice Chair.
ありがとうございます。
Thank you very much for the nomination. The representative of New Zealand has nominated the representative Tuvalu for the office of Vice Chairperson. Are there any seconders? Vietnam, please.
Vietnam would like to second the nomination of Tuvalu for the office of Vice Chairperson.
ありがとうございます。
Thank you very much. So the representative of Vietnam has seconded the nomination of Representative Tuvalu for the office of Vice Chairperson. Is there other nomination? There being none, I have much pleasure in pronouncing the Honorable Isaiah Baipunatape, Minister of Health, Social Welfare and General Affairs of Tuvalu, as Vice Chairperson. The Honorable Minister from Tuvalu is still on his way to Himeji, but I understand he has agreed to take on the role of Vice Chair when he arrives. Next, we come to nominations for rapporteurs. May I ask first for nomination for the office of rapporteur for the English language? Laos, please. Laos, please.
Malaysia to be elected.
マレーシアを代表を英語の書記に推薦いたします。
ありがとうございます。
Thank you very much. So now the representative of Laos has nominated the representative of Malaysia as English rapporteur. Are there any seconders? Singapore, please.
Singapore would like to second the nomination of Malaysia for the office of English Rapporteur.
ありがとうございます。
Thank you.
シンガポールの代表が
So the representative of Singapore has seconded the nomination of the representative of Malaysia for English rapporteur. Are there any other nominations? There being none, I have much pleasure in pronouncing Dr. Wan Noraini from Malaysia as English rapporteur. Now, I ask for nominations for the office of rapporteur for the French language. The Philippines, please.
Respectfully nominates New Caledonia for the post of rapporteur in the French language of the 72nd session of the WHO Regional Committee for the Western Pacific.
ありがとうございます。
Thank you very much for your nomination. The representative of the Philippines has nominated the representative of New Caledonia as French rapporteur. Are there any seconders? China, please take the floor.
I second the motion nominating New Caledonia, France to be elected for the post of French rapporteur.
はい、ありがとうございます。中国の代表が
Thank you very much. The Chinese representative has seconded the nomination of representative of New Caledonia for French rapporteur. Are there any other nominations? There being none, I have much pleasure in pronouncing Mr. Thibault Dimorf from New Caledonia as French rapporteur. Thank you very much. So congratulations to my fellow office bearers, and I look forward to working with you all to ensure smooth and efficient meeting this week. With that, I will now move on to the next agenda item. Distinguished representatives, WPR RC72 Rev 2 contains the provisional agenda. Are there any comments? In the absence of comments, the agenda is adopted. Now I'd like to invite the Secretariat to provide a short briefing on how we will organize our work this week. May I now call the Director of Program Management, Dr. Corinne Capuno. Dr. Capuno, over to you.
Thank you, Mr. Chairperson, and good morning, good afternoon, honorable ministers and distinguished delegates. Can we get the presentation on the screen, please? So first, on the meeting times, all the times I will be mentioning are in local time in Japan. The common core hours of the session meetings are from 9:30 a.m. to 1:30 p.m. There will be coffee break from 11:15 to 11:45 a.m. and a lunch is from 1:30 to 2:45 p.m. On Wednesday and Thursday, the Regional Committee will have additional common core hours to accommodate different time zones, and I will further explain this shortly. Regarding the management of the agenda items, for item 6, the Director General will address the Regional Committee via video. The message is pre-recorded. Since Dr. Tedros is not joining us live, the Chair will not take interventions on this item. For item 7, the Regional Director's address will include a COVID-19 regional update. It is requested that delegates combine their interventions on the Regional Director's address and the regional COVID-19 update in response to item 7. Item 10 on COVID-19 will consist of 2 briefings. The first will be a briefing by the co-chairs of the working group on strengthening WHO preparedness and response to health emergencies and the region bureau member from Singapore. The second will be a short briefing from the Executive Director of the WHO Health Emergency Program, Dr. Mike Ryan, on the newly established Berlin Hub for Pandemic and Epidemic Intelligence. Dr. Ryan's intervention is pre-recorded. This will take place right after the coffee break at 11:45 a.m., regardless of where the committee is in the agenda before the break for coffee. Following these briefings, the floor will be open for any questions to the co-chairs of the working group. The committee will then return to the rest of the agenda. For additional information, there will be a facilitated informal discussion on COVID-19 for those delegates attending in person in Himeji at 2:45. As I mentioned, you will notice from the tentative timetable that there are 2 items for which we have dedicated times for plenary discussions as common core hours to accommodate different time zones. This is one of the adjustments we are making to maximize the hybrid format of this meeting. The first item which will use this dedicated plenary session is item 9 on primary health care. The panel discussion on this item will take place tomorrow, Tuesday, beginning at 11:45 a.m., regardless of where the committee is in the agenda before the coffee break. Member States' intervention on this topic will be taken on Wednesday morning in the 1-hour plenary session beginning at 7:45 a.m. and will continue in the additional plenary session beginning the same day at 2:45 p.m. This item will conclude on Friday with a brief wrap-up from the Secretariat. A similar approach will be taken for item 15, coordination of the work of the World Health Assembly, the Executive Board and the Regional Committee. This item will be taken in several parts. Item 15.2, WHO reform, WHO's work in country, and the part of item 15.3 relating to sustainable financing will be taken together beginning in the session commencing at 11:45 a.m. on Wednesday. This session will include remarks from the regional director, the chair of the Sustainable Financing Working Group, and the Region Bureau member from Australia. This will be followed by panel discussion on WHO's work in country and a presentation on the key findings of the For the Future stock-taking exercise. Member States' intervention will be taken in the 1-hour plenary session beginning at 7:45 a.m. on Thursday and will continue in the plenary session beginning at 2:45 p.m. Thursday. This item will conclude on Friday with a brief wrap-up. For item 14, progress reports on technical programs, delegates are requested to kindly combine their interventions on the progress report. For the remainder of item 15.3, that is those components which do not relate to sustainable financing, they will be considered on Friday. This will include a short briefing from WHO headquarters on the next steps in the process for revising the 2022-2023 program budget. This will be in addition to the regional updates on the program budget scheduled for Tuesday morning. On side events, from Tuesday to Thursday, there will be a lunchtime side events on innovation, on mental health, and on communication for health. Finally, a few remarks on some practical matters. Member States are kindly requested to limit their intervention to 3 minutes. A timer will show on the screen. If you are sending in or reading an intervention, 3 minutes means less than 300 words. When you wish to address the session from the plenary here in Himeji, kindly press the big button on your microphone. For those joining virtually, kindly press the raise hand icon in the lower part of your screen. Your request to speak will be listed in the queue. The chair will alternate in calling on delegates in Himeji and those joining virtually. May I take this opportunity to remind distinguished representatives that the written copies of your remarks or outlines used in preparing them can be extremely helpful for report writers to capture your important intervention. For those participating virtually especially, written copies of your intervention ensure that your message is captured regardless of any IT issue, so please send them along to the RCM mailbox. Draft resolution will be made available at the Member States portal as of tomorrow morning. These are prepared before the start of the Regional Committee to facilitate the committee's work. Of course, revisions can be made to reflect the discussion on the specific agenda item. Please send any suggestion on the draft resolution to the Secretariat through the RCM mailbox before 3:30 p.m. on the day of the discussion of that item to ensure that rapporteurs will be able to consider your suggestions when they review the resolution in the rapporteur meeting. Also, rapporteurs usually appreciate when specific wording is provided in your recommendation. Lastly, Mr. Chairperson, I have been asked to advise delegates that even in this hybrid arrangement, we hope to be able to continue with the Western Pacific region tradition of making the Regional Committee a healthy meeting, including mobility breaks throughout the session. We are looking forward to seeing delegates participate in these. Thank you very much, Mr. Chairperson.
Dr. Capuano, ありがとうございます。Dr. Capuano,
Thank you very much, Dr. Capuano. So, as Dr. Capuano mentioned, we ask all honorable delegates to keep your interventions concise this week. There are many items to be covered, so it is very difficult to cover everything in time. I look forward to working with you to get through our very busy agenda. We now move on to the next agenda item. Thank you.
Distinguished representatives, ladies and gentlemen, it is now my great pleasure to introduce the Director General's address. Given the time difference with Geneva, Dr. Tedros will not be joining us live, but has sent a video message instead. Let's play the video message now, please.
Excellency Hiroshi Yamamoto, the State Minister of Health, Labor and Welfare of Japan, and Chair of the 72nd Regional Committee, Honorable Ministers and Heads of Delegation, and my brother Dr. Takashi Kasai, Regional Director of the Western Pacific, dear colleagues and friends. Good morning to all of you, and I'm sorry that I can't be with you in person. My thanks to Japan for hosting this year's Regional Committee, and my congratulations on a very successful Olympic and Paralympic Games. I was honored to be in Tokyo in July for the opening of the Olympics and to address the International Olympic Committee. I said then that I am often asked a simple question: when will the pandemic end? My answer is equally simple. The pandemic will end when the world chooses to end it. It is in our hands. We have all the tools we need: effective public health tools and effective medical tools. Unlike so many other health challenges, we can prevent this disease, we can test for it, and we can treat it. But those tools have not been shared equitably. The pandemic is far from over. Complacency is now as dangerous as the virus. Now is the time to be on heightened alert, not to let down your guard. I'm very pleased to see that cases and deaths from COVID-19 in your region have now declined significantly from the devastating peak in August, although I know some countries are still facing very serious situation. Almost 2/3 of people in your region are now fully vaccinated, the most of any region, although I know that there are wide discrepancies between countries and within countries. I very much appreciate Dr. Kasai's focus on ensuring health workers, older people, and other at-risk groups are prioritized for vaccination. WHO's global targets are to support every country to vaccinate at least 40% of its population by the end of this year and 70% by the middle of next year. Half of member states in the WIPRO region have already reached the 40% target, and WHO is committed to supporting the other half to get there too. WHO and our partners are doing everything we can to find ways of scaling up the production and distribution of vaccines as much as possible and as fast as possible. Almost 56 million doses have now been distributed to 21 WIPRO countries through COVAX, and we're pleased to see that COVAX is picking up speed. Between now and the end of the year, COVAX aims to deliver more than 150 million doses to WIPRO countries. Even while we respond to the pandemic, we must learn the lessons it's teaching us. As you know, there have been several reports and reviews of the global response to COVID-19 and of WHO's performance. As we have studied these reports, we have identified 4 key areas for action. First, we need better global governance that's inclusive, equitable, and accountable. The current global health security architecture is complex and fragmented, and voluntary mechanisms have not led to the coordinated and coherent global approach we need in the face of a global threat. New governance mechanisms are needed, supported by high-level political engagement and legally binding instruments that are inclusive and accountable. We believe an international agreement on pandemic preparedness and response will provide a much-needed overarching framework for global cooperation, setting the rules of the game and enhancing solidarity among nations. We seek the support of all WIPRO member states for this very important initiative as we approach the special session of the World Health Assembly next month. Second, we need more and better financing for national and global preparedness and response. Cycles of panic and neglect have created a financing ecosystem that's insufficient, inefficient, and inequitable. We need a substantial increase in domestic investment, including in primary health care and in international financing to support low and lower middle income countries. Crucially, we believe any financing facilities must be built using existing financial institutions rather than creating new ones that further fragment the global health architecture. Third, we need better systems and tools across the One Health spectrum. Already, WHO has taken steps to start building some of those tools, including the new hub for epidemic and pandemic intelligence in Berlin. Other initiatives are in development, including the WHO BioHub, a new facility for storing and sharing pathogens, and the Universal Health and Preparedness Review, a new peer review mechanism for enhancing national preparedness modeled on the Universal Periodic Review used by the United Nations Human Rights Council. And fourth, we need a strengthened, empowered, and sustainably financed WHO at the center of the global health architecture. With 194 member states and 152 country offices, WHO has a unique global mandate, unique global reach, and unique global legitimacy. But over several decades, it has been progressively weakened by a debilitating imbalance between assessed and voluntary earmarked contributions that distort our budget and constrain our ability to deliver what our member states expect of us. Redressing this imbalance is critical if WHO is to be the independent and authoritative institution the world needs it to be. We urge all member states to support and invest in strengthening your WHO rather than creating new structures that may only lead to more fragmentation. Excellencies, ladies and gentlemen, as always, your agenda this week reflects the wide range of challenges you face as a region, including school health, TB, traditional and complementary medicine, and primary health care. WHO remains committed to supporting each of your countries to respond to the pandemic and to build forward better, in line with the general program of work and the regions for the future vision. I would like to leave you with 3 specific requests. First, we seek your commitment to stay the course with the proven public health and social measures that we know work in combination with equitable vaccination. Second, we seek your support for the idea of an international agreement on pandemic preparedness and response. And third, we seek your support for building a stronger WHO that's empowered and financed sustainably. Thank you all once again for your hard work and support for WHO at this critical time. And we look forward to your continued support as we work together to promote health, keep the world safe, and serve the vulnerable. I thank you.
Thank you very much. As Dr. Tedros is not joining us live, we will not take member state interventions on this item, so that with this we conclude agenda item 6. Distinguished delegates, the regional directors, the report covering the 2021, this one-year period. It's a report on the activities of this particular period, WPRC 72, and the work of WHO in the Western Pacific region during this July 1, 2020 to 30 June 2021. So update will be given by the address of the Dr. Kasai, the regional director. So we are very pleased to invite the Regional Director, Dr. Kasai, to address the committee. Floor is yours, Dr. Kasai.
Chairperson, Honorable State Minister Yamamoto, Honorable Ministers, representatives from the countries and partners, ladies and gentlemen, welcome again to the 72nd sessions of the Regional Committee of the Western Pacific. Congratulations to our Chair, State Minister Yamamoto, and thank you very much for taking this very important job. And I would like to extend my warm welcome to this meeting and to the WHO community, to the Health Minister who joined us for the first time. It is not the easy time to be a Health Minister, but I would like to appreciate your strong leadership. And thank you all for being here, for those who are with us here in Himeji, and everybody joining virtually. Despite the difficult circumstances that we still find ourselves in, it is wonderful to be together with all of you. Excellency, a few months ago, I had a chance to talk to virtually with cello-like Blee, 108-year-old woman from remote Cambodia, just after she had received a COVID-19 vaccine. And as we have been preparing for this week's meeting, I have thought often about her, an extraordinary feat of science, logistics, and solidarity, which enable her to be vaccinated against the virus. While it has been another unprecedented 12 months, but it's people like a cello-like that makes me optimistic. Even though the COVID-19 pandemic continues to have devastating impact around the world. Our region had fared comparatively well until the middle of this year, thanks to a decade of investment in preparedness and response capacity. However, over the last few months, several countries in the region have experienced surges in cases driven by Delta variant and leading to an increase in the region's share of global cases and death. Whenever we speak about case numbers and death, I'm always mindful of the daughters, sons, mothers, fathers, grandparents, partners, brothers, sisters, and friends those numbers represent. And I'm aware some of you have lost your colleagues, including healthcare workers. And I would like to express my sincere condolences. And this has, of course, been an especially difficult time for healthcare workers, working non-stop to care for the sick and comfort the family of the dying. And we all owe them our deepest and most profound gratitude. Honorable Ministers, distinguished guests, delegates, the report in front of you highlights how WHO continued supporting countries over the last year to responding to the COVID-19, while at the same time driving forward the For the Future vision adopted at this committee 2 years ago. And I'm proud to say that almost all WHO staff in the region have been engaged in the COVID-19 response, either by repurpose to work on COVID-19 directly or by backstopping their colleagues who were repurposed. And staff in both categories revealed many previously untapped strengths. I was so impressed. We continue to monitor global and regional COVID-19 developments and update our guidance to the government and the public. And we established the regional whole genome sequencing network, and we have delivered essential supplies and equipment such as PPE and then oxygen supplies. We are supporting countries on strategic communications, and of course, we're working hard on COVID-19 vaccines. When we met just over a year ago, we still didn't know if any of the vaccine candidates then in the pipeline would be successful. But today, 7 vaccines have been given WHO emergency use listing, and globally, over 6.6 billion shots of COVID-19 vaccines have been administered. I think it's an unprecedented achievement. Last year, after the RCM, we established a dedicated COVID-19 vaccine incident management support team to focus on supporting countries to access sufficient supplies of COVID-19 vaccines and get these into the arms of the people in the priority groups, healthcare workers, older people, and those with the underlying conditions. There are incredible stories of the efforts being made to get vaccines to every corner of the regions, from outreach to vulnerable, marginalized, and hard-to-reach groups, like Chelo in her remote Cambodian village, and to many innovative vaccines communications, and to the Pacific ministers who had told me about their boat journeys to remote islands to personally deliver vaccines. We still have some way to go until all countries have enough vaccines, but we have made a good progress. And I would like to express my sincere thanks to all partners, including the host, Japan, Australia, China, the EU, New Zealand, the Republic of Korea, and the United States, who have supported all these efforts. In all our work on COVID-19, I believe the most important work of WHO at the regional level is connecting countries through our regional and country office, working as one team to facilitating the sharing of information and experience, and using these knowledges to learn and improve our response to COVID-19. Indeed, learn and improve philosophy is at the heart of the Asia-Pacific Strategy for Emerging Diseases and Public Health Emergency, or UPSET, the strategic framework which has guided our preparedness work for almost two decades. UPSET will continue to guide us as we look to the future, in which it seems increasingly clear that globally, the virus will not disappear, and therefore, we must shift our focus to what it means for the world, live with it. But this does not mean giving up on controlling the virus, but rather a focus on how we reduce the risk in the long term, as well as doing all what we can do to limit the emergence of new and more dangerous variants. With the support of UPSET Technical Advisory Group, UPSET TAG, we're developing a guidance for countries to plan for endemic COVID-19 with the focus on protecting a vulnerable and avoiding the lead line where the health services are overwhelmed. This will require action in 5 key areas. One is effective use of vaccine, and 2, continue application of public health and social measures, and adapting, adjusting, and sustain these for each specific conditions. And 3, expanding health system capacity, including through broader health system care pathways, and early detections and targeted response to flare-ups, and the risk-based approach to international border controls. We will also need to keep improving our capacity in surveillance, communications, and contact tracing and monitoring. And of course, we must continue strengthening health system with the long-term investment geared towards advancing universal health coverage. Successfully moving towards COVID-19 endemicity also means learning from the pandemic. With this in mind, in the last UPSET TAG meeting, we carefully reviewed the recommendations from the various global reviews, which was reported into the previous World Health Assembly. And we have begun incorporating those which are immediately actionable to our work in the region. On the other hand, developing a plan for areas which will require sustainable or long-term effort over time. Building a better future beyond the acute phase of COVID-19 pandemic also means continuing our work on many other health challenges our region faces, which member states ask us to prioritize when you endorse for the future vision. As the pandemic continues, people remain at risk and dying from non-communicable diseases. The climate is still changing, posing serious health risk. Antimicrobial resistance remains a major threat, and too many people continue to be afflicted by infectious diseases that we know how to prevent and control. These challenges pose huge risk to our health in the future if we don't take actions to change the future today. Our work in these areas continues, albeit with some plans changed by the pandemic. And in the last 12 months, we have seen some very impressive progress, such as China's historical elimination of malaria, and excellent inroads Cambodia, Laos, Vietnam are making towards the same goal. And Malaysia and the Philippines successfully closed very challenging polio outbreaks. On tackling the risk factors for NCD, such as Brunei adoptions of code regulating food marketing to children, and the Philippines moved towards eliminations of trans fats. As we confirmed recently in our stock-taking exercise, which you'll hear more about later this week, I firmly believe our shared visions remain as relevant as ever. So we have continued to focus on advancing, or in some cases, accelerating its implementations, even during the COVID-19. For example, COVID-19 has generated a range of innovations in health and health services delivery. which we are seeking to unearth with our innovation challenge currently underway. Our work on Health Future Dialogue is picking up pace with Mongolia, Malaysia, and the Philippines all engaged in long-term strategic planning for the future of health using this approach. We continue to forge stronger connection between different areas of works in supporting UHC by bringing together previously separated areas of work under this umbrella of a technical advisory group of universal health coverage. We are scaling up our work on communication for health and strengthening the relationship with the key. As we look to the future, I believe there are 5 key lessons we must learn from COVID-19 and through our implementations for the future. And we should reflect all these lessons in our work. We owe this to those who have lost their lives. First, it has never been clear that health, the economy, and the broader well-being of the societies are inextricably linked. Good population health is a driver of strong societies and economies. And I like to commit to work with all the ministers to use this recognition to advocate for continued investment in health as an engine for social and then economic development. The second lesson is about the importance of building strong health system. While COVID-19 has tested all countries, clearly those with strong public health system and very good clinical capacity have been most effective at minimizing death and limiting the impact of pandemic. This lesson will be important as we move towards the COVID-19 endemic phase. But it applies equally beyond COVID-19. And the key to this is healthcare worker. Our societies have not valued healthcare workers enough in the past, and we must do so in the future. And the third, protecting the vulnerable. The World Bank now estimates that COVID-19 has plunged nearly 100 million people into extreme poverty. When I think about the impact of the pandemic, this is the thing that worries me the most. It's an equal impact on vulnerable groups. And the potential for this to create a long-term divisions in our society. And fourth, partnership. COVID-19 has made clear that the partnerships are more important to health and the work of WHO than ever before. And we need to keep investing in our partnership, which will help us take our vision forward into the future. And fifth, effectively addressing global health issues require all of us to work together. You have heard me say this before, but it bears repeating. No country is safe until every country is safe. Indeed, this is a core principle which underpins upset. The same is true for the community and also individuals. And the only way out of this pandemic is for all of us to keep working together. Excellency, 2021 has been another very challenging time. But there are many things that gives me hope. When I became a regional director almost 3 years ago, I said then that I was optimistic because our region is home to extremely dedicated staff, committed member states, and caring healthcare workers, and very capable partners. And COVID-19 has shown all these things to be true. And most of all, it is the face of people across the region which gives me a confidence for the future. Like the women leader who I met in Samoa, Palau, so committed to improving health in their communities. The dedicated rural health workers in the remote parts of the Mekong, and the resilience of people like 108-year-old Chelo from Cambodia, who I spoke about at the beginning of the speech, and you may see her on the screen. And Chelo told me that she took the COVID-19 vaccine in part for herself, but mostly to protect her family and others in her community. As I thought about everything she must have been through in her long lifetime, it is incredible to think that she was born before the Spanish flu pandemic in 1918. And I was struck by the fact that the Cholai's main motivation was concern for the health and protection of the people around her. While many things in the world have changed dramatically in the past 2 years, but some have not, include this region's unifying belief in healthful, sustainable future, and the importance of thinking about our own actions and how that affect the health and well-being of others. Just as Chelo did when she took the COVID-19 vaccine for her family and her community. And this is why people like her motivate and inspire me. Honorable ministers and distinguished delegates, thank you for your trust in me in leading the work of WHO in this region. And I look forward with the hope and the confidence to continue our work together towards making this Western Pacific region the healthiest and safest regions around the world. Thank you very much.
Dr. Kasai, thank you so very much for your remarks. Now I'd like to ask Dr. Olowokle, Health Security and Emergencies, Regional Emergencies, to give us an update on COVID-19 in the region. Dr. Olowokle, the floor is yours.
Thank you, Chair. Honourable Ministers, distinguished delegates, guests, ladies and gentlemen, good morning and good afternoon. Before proceeding further, we would like to share with you a short video on COVID-19 in the region. Thank you.
COVID-19 is the greatest public health challenge in a century. It is having a devastating impact on communities, economies, and health systems. In 2021, the Delta variant has contributed to major surges in the region, pushing systems towards the red line, where hospitals and health workers are overwhelmed. Over 20 months into the pandemic, resources are stretched, and people are tired of the pandemic as well as the restrictions to suppress transmission. While vaccines are being rolled out around the region, access is uneven, and we still have a way to go. to ensure everyone in every country, especially those at greatest risk, can get vaccinated. But vaccines alone will not end the pandemic. We must also continue with other public health and personal protective measures, including wearing masks and avoiding crowded and closed spaces. The regional response to COVID-19 has been guided by the Asia-Pacific Strategy for Emerging Diseases and Public Health Emergencies, or APSED. Since the start of the pandemic, WHO's regional and country offices have worked as one alongside partners, providing tailored support to member states in the Western Pacific. This includes technical assistance and guidance on emergent issues, deployment of experts and essential supplies. Building on our approach of continuous learning and improvement, we must continue sharing data and experience and strengthening support to and cooperation between countries so that we emerge from COVID-19 with more resilient, equitable, and sustainable societies for the future.
Thank you. Thank you. I will now provide an update on COVID-19 in the WHO Western Pacific region. Can I have the slide set, please? So the next slide, please. This is a slide showing the global overview, and you will see different countries on the right, and on the left, different colors denoting WHO regions. The virus is now present in most countries and well entrenched. It is plausible that the virus will not disappear. We need to therefore anticipate continued surges and sporadic outbreaks. Next slide, please. The region was relatively spared in the first two waves of the pandemic, but the third wave saw several countries experience a surge. Nevertheless, a number of countries were able to successfully suppress transmission. In our region, member states quickly identified lessons, addressed challenges, and saw a reduction in case numbers, including in Japan. However, some countries are still experiencing a surge. For example, Australia, Brunei Darussalam, Papua New Guinea, and Singapore. Next slide, please. Some member states, including Australia, New Zealand, and Singapore, previously had success through the use of elimination strategies. Recent announcements from each of these member states has included a shift from an elimination strategy to one that plans for COVID-19 as being endemic. This shift in strategy is now possible because of the availability of COVID-19 vaccines. Next slide, please. This slide shows that vaccines have been secured but not received by our member states. The shortage of available vaccines means that member states face difficulty in obtaining sufficient vaccine courses. As a result, member states should use vaccines in an effective way by targeting at-risk groups such as healthcare workers and the elderly, and by ensuring that no dose is wasted. Even when vaccines are received, the challenge is how to make them accessible and to increase coverage. Some challenges faced include vaccine hesitancy, challenges in getting the vaccines to communities, and difficulties getting the vaccine into people's arms quickly and efficiently at local level. Next slide, please. The Asia-Pacific Strategy for Emerging Diseases and Public Health Emergencies is a strategic action framework in the region for implementing the IHR capacities. It is currently in its third iteration since the first one was implemented in 2006. Each year, an APSED TAG meeting is held to monitor implementation of APSED and IHR and provide technical advice and recommendations on priority actions. The TAG meeting brings together TAG members, member states, WHO, and partners to share and discuss key achievements, lessons identified, and best practices. Next slide, please. A number of guiding principles steer the implementation of APSED and support advancing member states' capacities. And the slide illustrates several of those guiding principles. While substantial progress has been made over the past 15 years of APSED implementation, the COVID-19 pandemic has shown that preparedness efforts must continue, as several gaps have been identified. At ABSED-TAG 2020, the lessons and experience of member states in relation to the first 6 months of responding to COVID-19 were reviewed. Next slide, please. At ABSED-TAG 2021, the experience of member states and the lessons identified from 18 months of responding to COVID-19 were reviewed, along with conclusions and recommendations from reports presented at the 74th World Health Assembly from the IHRRC, the International Health Regulations Review Committee, the IOAC, the Independent Oversight and Advisory Committee for the WHO, and the IPPPR, the Independent Panel for Pandemic Preparedness and Response. The TAG 2021 meeting concluded by providing recommendations grouped under 2 outputs. Output 1 focused on short to mid-term recommendations and paid attention to 2 scenarios. One scenario was that the virus is entrenched globally, and as such, consideration should be given by member states to treating COVID-19 as endemic. The second scenario was the potential for a pandemic within a pandemic, where a more virulent variant emerges that evades vaccines and has severe impact. Output 2 recommendations focus on long-term strengthening of health systems to make them more resilient, and member states asked WHO to study and determine the elements for a preparedness framework for the next pandemic. Next slide, please, and this is the final slide. WHO is developing guidance for member states on planning for endemic COVID-19. The conceptual framework shown has 2 reference points at the top in the triangle, and these can be used to calibrate the response. The red line, which we want to avoid, is the point at which the capacity of the health system is exceeded. We also want to protect the vulnerable populations. While vaccines are important and key to the response, they cannot suppress transmission on their own. They should be combined with public health and social measures that we know work. These public health and social measures may be individual-based, risk-based, or population-based, also known as blanket measures. Blanket measures may be applied in areas where cases are rapidly increasing and include school closure. Schools are very important, and their closure impacts negatively on children's health and well-being. From a public health perspective, deciding to close or reopen schools should be guided by a risk-based approach, taking into consideration the epidemiology of COVID-19 in the community and other factors, including the range of public health and social measures being implemented outside school. As such, efforts should be made to reduce community transmission in order to reopen schools, which are an important part of the community. Other actions shown as key areas in the framework are early detection and targeted response, important to detect infections early in order to suppress transmission, improving capacity of the health system as a means to prevent the red line being exceeded, and international border measures that take a risk-based approach to manage the risk of exportation, importation, and onward transmission of COVID-19. These 5 areas are supported by 3 important pillars: surveillance, communication, and contact tracing. Taken together, these key areas and pillars advance and strengthen capacity for preparedness and response to large-scale community transmission, and require a command system to coordinate a multi-sectoral whole-of-society approach. Long-term investment in health systems, applying ABSED principles to realize the vision in For the Future towards the healthiest and safest region, and using universal health coverage as leverage can enable more resilient health systems and societies in the future. Thank you, Chair. This completes my presentation.
Thank you very much, Dr. Walker. At this point, we'd like to take the picture, and then we have a coffee break. So at this point, we'd like to just stop the discussion at this moment. And then after that, after the break, in the afternoon, we'd like to continue this discussion. Before the coffee break, we'd like to take a picture including the ones who are participating virtually. And then we would like to resume the session at 11:45. So we'd like to ask the director of the office, secretarial office, to explain how to take a picture.
Thank you very much, Mr. Chairperson. As the Chair just mentioned, we were able to take a photo of those physically here in Himeji this morning, but of course we'd like to capture all of you joining us online in a hybrid group photo as well. So could I ask everybody to switch on your cameras? Delegates, of course, non-state actors and partners, interpreters, please switch on your cameras and give us a big smile. Bear with us for a moment while we capture everybody. Even if you're wearing a mask, we can still see your eyes smiling. I hope you can see my eyes smiling. Okay, just bear with us while my colleagues tell me if we've captured everybody. We're going to do this in two parts. First, a standard smiling photo and then a waving photo. So let's just keep smiling for the moment. Great, now I'm going to ask everybody to give us a wave. It's a Wipro tradition that we have a waving photo. Keep waving, just bear with us for a couple more moments. Okay, I think that's good enough. Great. Thank you very much for indulging us in that. Mr. Chair, with your permission, I understand that the Director of Admin and Finance has a couple of very brief administrative announcements to make, so if it's okay, we'll turn to him briefly now before we take the coffee break. Daph, over to you.
Thank you very much, Angela. So I apologize in advance. For those of you that come to these often know that Monday's announcements are a little bit longer. I will try to keep them much shorter for the other days. For those of you joining virtually, DPM has already outlined the program, so you can go ahead and take your coffee break, and I'll address the issues that are very pertinent to all of us joined here in Himeji. In line with the hybrid approach, as everyone knows, our goal is to keep each other safe, keep the public in Japan safe, and for a safe return to our homes. Because of that, we ask that we all continue to do our part within the bubble. You're asked to avoid close contacts, follow standard infection control measures, like mask wearing, of course, physical distancing, hand washing, and general awareness. Our risk mitigation bubble means participants need to stay in the hotel when not attending the session or the related social functions. We'd also ask for everyone to please check your temperature in the morning. If you have a high temperature or you don't feel well, please remain in your hotel rooms and inform the Secretariat and your liaison officer. And as you would have done this morning, please have your antigen test sample done first thing in the morning. Nurses are available at both the venue and the hotel for any medical support that's needed. And a little bit more about the program today. The coffee break and daily lunch will be served next door to this hall in Exhibition Hall B. After lunch today, starting at 2:45 p.m., there is a facilitated informal discussion on COVID-19 for in-person participants in room 407, which is on the 4th floor. There's escalators and an elevator to get to that room. There's also a first meeting of the rapporteurs, which will be held in room 408 from 3:45 p.m. today to discuss the work of the group for the week. The transport shuttle to and from the hotel is available daily. Please check the transportation boards near the entrance of the venue and the hotel, or contact our inquiry desk out front if you have any questions. Tonight, the Mayor of Himeji City will host a reception for all participants at the Belvedere Function Room on the 3rd floor of the Hotel Monterey and that starts at 6:30 p.m. And tomorrow, we'll start at 9:30 in this hall. However, there is a Pacific Island country side meeting, which begins at 7:45. And for those delegates here in the venue, we have prepared a thank you signature board we would like to later present to the hosts. There's two of them, and they're standing outside this venue. So the next time you pass by, please sign on both boards to register your thanks for both the city of Himeji and the prefecture of Hyogo. And just a few more general things. Please remember to wear your badges. In case there's an emergency with an alarm system, please find your nearest emergency exit. There's two in this room lit up with green lights. In case of earthquake, please do the duck, cover, and hold. And then once it stops shaking, head out the emergency exits. Also remember the wireless receivers need to stay in the hall. And then one of the most important things, like always, no smoking policy for all WHO meetings. So thank you for bearing with me today. I promise to be shorter tomorrow. So that concludes this morning's session. So coffee is next door. Thank you.
Greatest dream blow me dream blow one day me regime Olympic Games. All best no more, all my international champions no more, only play lo games. And me regime dream blow me and me glad. Time me stop overseas and Vanuatu fly, can me fly on top. Tears blow me master. From one and from me proud said, we stop represent them. All people blow me.
Recording stopped.
One very good feeling. Me Annalyn, me play table tennis. Me represent Vanuatu, lo sport now. Me grow up lo island. Also one pikinini, me grow up. Kakai island kakai. You kakai Navara, you kakai Navel, you kakai something fruits. And me go lo Karen, walk lo Karen. Then me come lo town. You look life, one life where it different all geta. Main thing now you start looking non-communicable diseases, me big one lo Pacific, and you me lo Vanuatu, full of man only stop death lo sikia. So suppose you got one active life also. You move plant days, you sweat out, but you feeling me good and me want something where I me make him blow you no save kasim sikia. Anyone is have a play sports. From everyone you can right to play sports. Me no save do him one way me do him today. Sports me no got support lo family. Vanuatu, especially as one woman, okata blow house, okata blow kitchen, blow cook, blow wash, look out in pikinini. But now blow me very important lo me. He mi save support me lo day one kasem now ya. Him look out in pikinini, make him say me save continue blow make him one way me love him. Me one mama blow 2 boys, and I'm already 42. Me still feel very strong. Sport him also one medicine blow body from me. It make me stop. Fetal time. Mentally too, me feeling me helping me building confidence. Now yeah, me have started on one business plan me lo side lo fitness industry and me want something where me never think about me making more same full up mama lo Vanuatu only no exercise. Me go lo gym me no look one mama. And me want fitness exercise and me Zumba and me put them out all mama only come. Me fly exercise and then only like it. Ikat sambala we first time only come. Only sagat knee pain, only sagat back pain, so only come try mo. And me ask him all get how only feel, only say knee so he loose, back pain he loose, only feel more relaxed, only feeling good. That's why only come every time. Me want them continue below me stay healthy and continue below making exercise as long as me still alive and well. Me continue below live healthy lifestyle.
今天是他感染的第3天。大家好，我是海棠，一名饮食摄影师。我老婆叫李婷，一名医院急诊科的护士。我希望通过这个视频来记录我们抗击肺炎的点点滴滴。每次全副武装进入他的房间。刚量了，量烧没有？有了。家里的每一个地方也都要消毒，让病毒无处可跑。该吃的吃的。做好他爱吃的每一个菜，补充营养，希望他有充沛的体力去打败病毒。没事，我就在里头吧，不出去了。我不要你在里面。你不了。所以我们准备今天去医院复查。怎么样，老师？他有问题吧？
老师怎么样了？好像有问题。
还是有问题。医生说 CT 片子上面显示感染有加重，住院治疗是我们现在最好的选择了。
我觉得我的身体太大了，我觉得身体都太大了。老婆，你后不后悔跟我结婚？
不后悔，我一点都不后悔。
你后悔？
我不后悔，我一点都不后悔，真的。我很幸福啊。
你后悔？你后悔？
我真不后悔，我后悔没有早点认识你。我和儿子在等着他的痊愈。我老婆明天终于要出院了，然后我现在特别兴奋，真的是很开心，就是太开心了，太煎熬了，真的是太煎熬了。然后真的是这段时间，我感觉所有的努力也没有白费，然后终于快熬到了这一天了，真的是太开心了，很开心现在。
哎呀，亲一口爸爸，亲一口爸爸。你赶快给你。
这段生死的历程，在我们的生命里刻下了一道深刻的印记。未来，我希望我们都能好好的。我希望石头长大了，能记住这一年，记住他的妈妈受过的苦难，记住那些为疫情付出的人们。你现在身体怎么样？
好得很呢，不然你为什么要我做卫生呢？一回来就
我没有要你做卫生，是你自己回来，这里要搞那里要搞。
Na o toki mi o se em gati poli. Em no ko pa. Mo se baby. Em no sana sit down kayeti. Em mitla sa 6 months or 5 months kay musi. Au sike mitla goya. Every Wednesday mitla goya. Also toki mi lo. Avinun mi mas. Boiling water, morning, navinu, mi boiling now. Put it leg, block na pulim, molig, leg, can, finger, stretching, most now. Poti do. Okay, now all family will start on the flyer. Authority mitla rol baka mitla to area. Mitla rol baka mitla sit down. Me worry. Me sinti dobla sinti. Me cry. Me oklo pray lo papa God lem by helping me. Sani si pikini blend or carry me go. Bang for suicide the most to car. Mita milas lem ba kizim. This la sick cripple lem ba stop one me because me no carry this la kan pikini me. Me oklo boiling water. Women hand blame black blogger. Making me gonna emoklo crawl or some baby crawl ligo. Me tired and you exercise me. So night me tla no actually me tla say exercise me. Ego. And start them crawl wrong. Me oklo pray lo God asol me continue me pray here. The big man help me this la beginning. Stand up inside the house me the sister them me la stand up and holy hand look at me. Walk about ego. Na me talk thank you na me big mouth na me cry. Toko sa mi mama ka mi toko sem. Avel dol mas kisim nista drop. Em no kisim so em kisim nista sick. Ay man logo em sa helping me. Em baka sit down helping me. When them leave walk me em mas come helping me. Em baka clean me sweat lo me. Em sa helping me good.
あの時私は孤独でした。高校時代の私は自ら命を絶つことも考え、一人苦しんでいました。後に私は信頼できる恩師に奇跡的に出会えたことで問題を乗り越えられました。問題を抱えた人が奇跡や運や偶然でしか僕にとっての先生のような頼れる人と出会えないというそういう環境はおかしい。問題を抱えた人が確実に頼れる人にアクセスできるような仕組みを作り、望まない孤独を抱えることがないように我々はあなたの居場所というのを立ち上げました。あなたの居場所は24時間365日誰でも無料匿名で利用できるチャット相談の窓口になります。私たちにアクセスをしてくださる方のほとんどが29歳以下の子供や若者たちになります。メンタルヘルスに悩む多くの人に共通している課題は孤独を抱えているということです。友達や家族は近くにいるけど相談できない、頼りたくても頼れないという状況にあります。私たちのミッションはこうした状況をなくすこと、つまり望まない孤独をなくすということになります。私たちはまずは話を聞いて、そして自分の気持ちに寄り添ってもらえる場所がある、自分は一人ではないというふうに感じてもらうことが大切だというふうに考えています。間違いなくこのコロナによって人々のメンタルヘルスというのは大きな影響を受けたと思います。実際にデータを見てみると顕著で、特に子供や若者、そして女性が影響を受けています。ただパンデミックによってメンタルヘルスに対する考え方というのは大きく変わったと思います。例えば、このパンデミックの中で、多くの人がメンタルヘルスの問題を抱えているということは、社会に広く知られるようになってきました。僕自身はやっぱり望まない孤独をなくしたいと思って今この活動をしていて、相談師さんと日々接している中で、その相談師さんが抱える本当に苦しみというのがよくわかるんですよね。自分自身もそうだったので、孤独対策をやろうと言って少しずつ、社会が動いてきたと思います。若者が自分の言いたいこととかやりたいことを言ったとしてもそれが認められないっていうふうに言われてますけど、しっかり理由があって、そしてどういう社会を築いていきたいのかっていうビジョンを示すことができれば、学生であっても若者であっても、少しずつかもしれないけれども 社会を動かしていけるというのはこの経験から学んだことですね。
เราต้องเตรียมพร้อมบ่ว่าจะเป็นตอนสายตอนเช้าตอนสายหรือว่าตอนกลางคืนเนาะสำหรับสุขศาลาเฮาแม่นก็แม่นอยู่เขตห่างไกลเนาะถ้าว่ามีคนเจ็บมาก็พร้อมที่ว่าจะช่วยเขาเจ้าเฮาเฮ็ดเวียกอยู่กับชุมชนมันจะมีความสุขแล้วก็มีความภูมิใจหลายกว่าอันถ้ามารู้สึกเมื่อยบ่ก็บางครั้งก็เมื่อยเนาะแต่ว่าเฮาเฮ็ดไปแล้วที่ว่าเฮาซอยไปแล้วเนาะเห็นเด็กน้อยกับแม่แข็งแรงคือว่ามีความสุขแล้วลืมไปเลยมีกรณีนึงเนาะที่ว่ามาเกิดลูกเนาะในเบื้องต้นที่ว่าปกติทุกอย่างเนาะหลังจากเล็กออกแล้ววันนี้แฮบ่โคเนาะแฮบ่โคเราเฮาก็เฮ็ดนวดมดลูกแล้วแต่ว่าแฮก็ยังบ่โคแล้วเฮาก็รู้สึกทั้งย้านแล้วก็ประสบการณ์เฮาก็แบบว่าบ่เคยเจอสักเทื่อเนาะจากสุขศาลาเฮาไปหาห้องหมอก็60กว่ากิโลสำหรับสุขศาลาเฮามันบ่มีเนาะมีแต่เดี๋ยวนี้มีแต่อันคืออ้ายมันเป็นอันเจ้าพยาบาลคือน้องพะโรงคันมี2คนด้วยแล้วก็ทางญาติแน่แต่ว่าก็พยายามเฮ็ดสุดความสามารถได้อันใส่ถุงมือยาวเพราะว่าจกเอาแฮออกแล้วหลังจากเฮาปฏิบัติแนวนั้นแล้วก็แม่ก็ปลอดภัยถ้าว่าบ่มาเกิดอยู่สุขศาลาก็คิดว่าน่าจะบ่รอดเนาะรู้สึกภูมิใจที่สุดด้วยความรู้สึกของเฮาณตอนนั้นน่ะก็คือว่าเฮาช่วยชีวิตคนคนหนึงได้เนาะแล้วเฮาก็สิพยายามแบบช่วยต่อไปเรื่อยๆย้อนว่าเฮาลงไปเนาะมักที่สุดเลยเขาแบบแม่นแบบว่าถือเป็นกันเองเนาะคือแบบคนในครอบครัวกล้าเว้ากล้าว่ากล้าปรึกษาคือว่าตัดสินใจแล้วว่าจะเฮ็ดเวียกอยู่นำชุมชนตลอดไป
Анхны үүрэг гүйцэтгэх хугацаанд би өөрийн гар дээр эмийг алдлаа. Анх прогтой ганц ангил гэдэг цэргийн төвөмлөгийн эрчим дэмжлэгээний хэмж дэслэг цалтай. Манай эмээ тийм биеийн байдал жоохон тогтвортой гайгүй байх үедээ би сайн байна. Одоо гэртээ гарна. Миний хөө мундаг сайн ажиллаж ийн гэж амьдралынхаа эцсийн мөч хүртэл бас тэмцэжсэн явдал доорлоод татсан санагддаг та. Саяны сүүлийн үүрэг гүйцэтгэлээр нэг өдрийн дотор нэг цагийн дотор 3 хүн нас иржсэн тохиолдол гарсан. Бид бүх минутанд бол тэр 3 хүний ар гэрийнхэн өөр хүүхдүүд нь ач зээнэр нь л ер нь бидний нүдэнд харагддаг. Яаж ар гэрт нь одоо биеийн байдал нь ийм байсан одоо ийм болоод өнгөрчлөө гэдэг юм уу тэр талаар мэдээлэл дуулах их хэцүү. Тэгээд одоо үүрэг гүйцэтгэж явах үедээ тэр нь бол одоо миний эмээгээс өрцөхгүй миний өвөөгөөс өрцөхгүй гэж ер нь бол миний ойр дотны хүн шиг л одоо бүх хүмүүс харагддаг учраас тэдний хайнасыг нь аврахын тулд бид бүхэн ер нь өдөр шөнөг бол өөрийгөө гүйцэтгээд өргөсөн тагарахтай хүнчрэг зүтгэж явж байна. Хүмүүсийн ер нь биеийн байдал сайжраад эмнэлгээс гараад хөл дээрээ бусаад гарч исэн тохиолдол бол зөндөө байгаа. Тэр хүмүүсийн гарахтаа баярлаа гэж хэлж байгаа үг нь ер нь одоо л миний сэтгэл санаанд их тод идэг. Дуртай газар их юм бол зайсан толгой дээр нар жаргах цагаар гарч хотын байдлыг харах. Зайсан толгой дээр гараад зогсоход нэг сэтгэл уужраад уушиг тэлэгдээд ингээл дотроосоо их тайвширлыг л мэдэрдэг. Хөл хорооны байдалтай холбоотойгоор л манай найзууд сүүлийн хэдэн сар ер нь уулзлага байгаа. Одоо бид бүхэн одоо хоорондоо таарах магадлал хомс ер нь бол байхгүй болсон. Тэгээ одоогоор ингээд 100 гаруй насаар л ингээд гарчаад байгаа. Энэ чигээр ингээд тэг энэ тоон дээр ингээд бариад ингээд зогсоо.
Recording in progress.
Ард иргэд хүн бүхэн мэргэжлийн байгууллагаас гарч байгаа тэр заавар зөвлөмж гэдэг юмыг л заашгүй биелүүлэх шаардлагатай байна. Энэ вакцин гэдэг зүйлтэй хүн болгон л идэвхтэй хамрах тасаа л гэж хүсэж байна.
Gulat kami bakit nauso dito yung tigdas dito sa amin. Nag-umpisa po noon sa taas po namin nakatira. Tapos po sa katabi rin po namin nagkatigdas. Tapos yung anak ko pong 3, ayun po, kawawa na po. Bali, ang pamilya ko po malaki, marami po akong anak. Yung anak ko po, 7, anak ko po, yung mga kumpleto po bakuna. Bali, 3 lang po. Ayun, hindi na po napabakunahan. Yung 3 po, yun. Yun talaga po yung mga nagkatigdas. Nung balik po nung kasama po yung tatay ko, ayun po, medyo nakakalawa kasi nakapaghanap buhay po ako. Balik tatay ko, nagbabantay. Ito lang talaga na wala lang din tatay ko. Wala magbabantay sa mga anak ko. Ayun lang po, di na ako nakapagpadala sa center. 9 months po yung baby ko. Tapos sumunod po, 3 years old, tsaka 4 years old po. Nung nagkatigdas po. Una nilalagdas, may ubo po. Tapos nakita ko po may pamumula na po sa katawan nila. Tapos mga ilang araw, naging itim na. Kasi dumami na sila ng dumami. Lagnat lang po talaga yung binabantayan ko kasi yung pinakakatakot. Yung mag-convulsion, sabay-sabay po sila, 3. Doon po ako natatakot kasi umiyak lang. Hindi ko alam kung ano yung nararamdaman po nila. Kaya natatakot ako. Anong masakit sa inyo? Tanong ko ng gano'n. Wala, iyak ko lang. Naawa po yung mga kapatid niya po. Sabi nga ng anak ko po, ba't di pa dali sa ospital? Kasi nga yung natakot nga rin anak ko po. Sabi ko, paano ko dadalhin? Walang magbabantay sa ibang kapatid mo. Pumayat po talaga sila, natuyot yung balat, halos ayaw kumain. Sabi ko, kung pwede lang, balikan talaga. Sisisi rin din po kasi ako nun. Kung napabakuna ako po talaga, hindi sana magkakagaling ng anak ko. Nakayanan din po sa awa po ng Diyos. Siguro pa mga 5 araw, 4 na araw yun, nakakain na po sila. Okay na po sila. Normal na po. Yung panganay po na apo ko po, ayun, kompleto rin po bakunan. Talagang pinaano ko sa anak ko na pabakunahan niya yan. Libre naman yan, wala namang bayad. Bakit di ka magpabakuna? Sabi ko sa anak ko. Ang sasabihin ko lang po sa kanila na hanggat maaga, pabakunahan mo yung anak mo. 7 kong anak, hindi nagkatigdas. Tapos yung 3 nagkatigdas. Mahalaga po talaga yung bakuna. Wag po silang tamarin. Para sinasabi po nila, hindi totoo yan. Totoo po talaga yung bakuna po.
1月23号武汉封城大家都没有任何的准备，那明显的大家就一定会产生各种各样的心理的上面的问题。平时呢，我是一名普通的心理工作者，在疫情期间呢，那我担任了很多的心理援助的工作。刚开始的时候，电话其实上是蛮多的。在疫情期间找我来做心理咨询，其实上基本上
Test 1 2 3。
比如说，我就拿普通的民众来讲哈，对吧？我的存款能撑多久？我会不会被感染？喂，哎，听得到？我接到一位医护可能压力比较大就在电话那头哭。你想想，穿上那么厚的防护服进去几个小时不吃不喝，面对生死面对病人的生死，以及面对被感染的风险，我们沉默了很长一段时间。那我们会更多的是倾听。其实他只要能够感受到我不是孤单的，他就能够有信心走下去。疫情期间的心理援助工作，除了线上的这个咨询以外，还要到方舱医院和隔离点里面去做面对面的直接的这种援助。 那天第一次进隔离点真的很害怕，刺鼻的这种消毒水的味道，每一位小哥哥小姐姐都戴着口罩和眼镜，分不出来谁是谁。我第一个来访者有一个婆婆，她就拉着我的手，然后特别多想要跟我讲的。她已经好长时间没回家了，然后她已经70多岁了，没有人可以跟她有过多的交流，她那一下握着我的手，特别的就是给我的感觉就是眼泪都要流出来了，所以才让我觉得这样一份工作非常的有意义。封城这么久70、80天我自己也有想发疯的时候一天又过了一天，然后在这个过程当中也特别的难熬特别是我的工作接触到
それではアイテム10の COVID-19
We are moving on to item 10, COVID-19.
We listen to the situation of COVID-19, and then at this point, we'd like to ask Dr. Lin James to speak about the situation. He is and also Dr. Mirata. So, as we have already heard the regional briefing on COVID-19 earlier today, it is now my pleasure to call on Regions Bureau member Dr. Lin James from the Ministry of Health Singapore and co-chairs the working group on the strengthening of WHO. Ambassador Grata, Mr. Colin McLeaf, Dr. James, you have the floor.
Thank you, Chair. Chair, Excellencies, and distinguished delegates. Singapore is honored to serve as a Bureau member representing the Western Pacific region and appreciate your trust in us for this important work. In accordance with WHA Decision 74/16, the Bureau has prioritized the assessment of developing a potential international instrument on pandemic preparedness and response, and to provide a report to be considered at the special session of the Health Assembly to be held in November. Following the confirmation of the Bureau at the end of June, work commenced quickly. To date, there have been 3 working group meetings and 5 deep dives, including one scheduled later today. This reflects the commitment of the Bureau to fulfill the mandate given to us by member states, and testament to the extraordinary efforts by the WHO Secretariat to facilitate the work of member states. The work has paid off, and we have seen some convergence in positions. Member states have reaffirmed the importance of the IHR as a key component of the global health architecture. And many have expressed support to explore strengthening the IHR through targeted amendments. Equally, many others have highlighted that there are a number of issues that fall outside the scope of the IHR, which could potentially address in a new legal instrument. The co-chairs of the Bureau are here with us today to brief our regional committee on the progress of work since the last meeting. As the next working group would be held the week following this RCM on 1st November, the co-chairs will also be providing a quick walkthrough of the zero draft report intended to be discussed at our working group meeting next week and submitted to the special session thereafter. The Bureau is also cognizant that the working group would have to submit a report with proposed actions for the WHO Secretariat, member states and non-state actors to the Executive Board in January, and work will continue on this. Singapore thanks WIPRO member states for your commitment shown through your active participation in the process thus far, and seeks your further support as we collectively work together to strengthen our global health system. I will now pass the time over to the co-chairs. Thank you. Co-chairs, please.
Thank you so much, Dr. James. Thank you, Chairperson, Dr. Kasai, all colleagues, excellencies. It's really excellent and wonderful to be with you all today. Frankly, it has been a complete privilege for me as a member of my government's health ministry, in the Office of Global Affairs, to be able to play this role, to take this role as co-chair and bureau member from the Americas region. But I'm also quite conscious that the United States is a member of the WIPRO region as well. And I just want to thank all of you first and foremost for the very active and substantive participation by so many different member states from the WIPRO region in our process so far. As you all know, because you were part of these decisions as well, member states set for ourselves collectively a very difficult task in May. Two tasks, in fact, both to review the very many and very thoughtful recommendations from the three main panels that had looked at the COVID response, the IPPR, the IHR Review Committee, and the IOAC reports, and look at those recommendations, consider how to use them in strengthening WHO, both its leading and coordinating role in global health, and in particular in pandemic preparedness and response, and also looking more broadly at the global health architecture. And the IPPR recommendations are a great example of those types of recommendations, as Dr. James was talking about, that go well beyond WHO and well beyond the health sector and are challenging. Then at the same time, we member states set for ourselves this task on a very accelerated timeline of looking to the special session, calling a special session of the World Health Assembly at the end of next month, and considering the benefits of a new convention, agreement, or other type of instrument. We've held 3 meetings now. They've been very rich, very substantive, also challenging. As Dr. James said, there are many areas of convergence. There also remain a lot of areas of divergence. But one thing, as we were preparing the zero draft of the report, which will be sent in an advanced form to all delegations tomorrow via the WHO Secretariat, one of the things that we saw clearly is that many times the divergence between member states is not actually on the priority itself. For example, early surveillance and detection and improving that for all countries. Everyone wants to do that. The divergence is, of course, on the how and the details and what to do and what are the different responsibilities at national, regional, and global level. So when we have the report, when you have the report, you'll see that we tried to be very straightforward with it, going through the history of the working group, the background, being very clear and very specific on the 2 mandates and the interlinked nature of those mandates. Then looking at the emerging priority areas for further deliberation, and those areas are in a range of areas, from leadership and governance to systems and tools like the IHR themselves. How do we strengthen the IHR? How does the IHR relate to a possible new instrument? And then looking at finance, the role of sustainable finance, both for WHO and for countries. And then finally, the issue of equity and equitable access to medical countermeasures. As we all have seen and know full well, unfortunately, the pandemic has not been a very good example of global equity and solidarity despite many very good faith efforts around the world. And so this is something that member states are all saying we must address in an effective and meaningful and impactful way, recognizing that there are challenges in that and complexities in that as well. We go on in the report to propose a way forward, both for the special session and beyond, and how these negotiations can be taken forward in a meaningful way. One of the things that you'll hear from us and you'll see from us as a Bureau, from all 6 members of the Bureau, is that we do believe there's a possibility for a consensus. Many member states have focused on 2 broad themes across all of the meetings that we've held so far. First, that the status quo is unacceptable. And second, that there doesn't have to be an either or solution in moving forward our collective negotiations and our collective political will to make change in the global health architecture. And so what we will try to do with this zero draft report is our best attempt to point a way forward on that potential process where we can potentially launch a negotiation on a new instrument, while at the same time strengthening the systems that we have, the institutions that we have, and the tools that we have, starting with that very key and critical foundational document of the International Health Regulations. So that's a preview for everyone. Thank you so much. I know I've taken a bit of time. Ambassador Grata, if you wish to come in, and I really thank you again for this opportunity, and do look forward to any opportunity for dialogue we have, and look forward to your country's participation in the upcoming meetings as well. Thank you.
I hope everyone can hear me. Thank you, Chair, and of course, would like to thank everyone, and also the Dr. Kase, and of course, one of our member of the Bureau, Dr. Lynn James. Of course, it is a pleasure for me to be here to join my fellow co-chair and thank you so much for giving us the opportunity to speak and provide the update of our the work of our working group. I didn't want to add much, just would like again to underline and echo my fellow co-chair in conveying our appreciation for the very active and constructive engagement that had been shown by member states from the Western Pacific region. And actually, during the course of our conversation, the working group, some of the intervention coming from the countries in your region has been very useful in guiding the Bureau on how we are going to move the working group forward. And this is for us is very important, because we also understand that WIPO countries are I think the most experiences in dealing with the COVID since the beginning of the outbreak. And there's also been a very good example of cooperation between the countries in the region to help and manage pandemic. And what's more importantly, that this cooperation also extended to country beyond your own region. And coming from the Searo region, we do, of course, take the benefits of some of this good cooperation. Now, many of the success story of the countries in the WIPO has been valuable, a contribution to our discussion. And hopefully this will, of course, enrich the discussion and, of course, how we are going to address the mandate. Just again, as a co-chair, I believe this is my responsibility also to underline that the working group was established by member state. It was a forum for member state, and the end result of the working group will be up to the member state. So we, as the Bureau, will try our best to facilitate the discussion. I think the idea is we can work collectively to fill in the gaps of the COVID-19 has exposed on the health architecture, both at national, regional, and also global level. And today, actually, we will have our last deep dive before the fourth working group on architecture. I hope this will be another good dialogue that we have on focusing on finance, on governance, on the implementation of One Health approach. Just as Colin said, that the the next working group meeting will be convened on the 1st to 3rd November. Will focus on the discussion of preparation of the report, and we understand that the report from the discussion we do has touched upon a lot of substantive discussion, and the report will do its best to reflect those discussion, maybe not as deeper maybe as some of the member states would like to focus, but again the report itself will focus on the process, on how we are going to move forward with the working of the working group. We do have another report as per mandate of WHO 74/7 on proposed action on the various recommendation received from the review panels, and we will start drafting the second report at a later stage, and the second report will be submitted next year through EB 150 for the WHO 75. And I would like to again kindly ask the understanding of the working of the member state that we do have a very limited time to work, but we will do together our best to move the process forward. And with that, I would like again to thank everyone for your time, and looking forward to listen to any question and discussion coming from the member state. Thank you.
Thank you
very much, distinguished three speakers. Now, from the headquarters of WHO, we would like to introduce the director in charge of health-related equipment. Dr. Ryan will have the report on this newly established Berlin Pandemic Information Sector. So we have a video message sent by Dr. Ryan. So now we'd like to hear the video clip by Dr. Ryan.
Your Excellency, Honorable Hiroshi Yamamoto, State Minister of the Ministry of Health, Labour and Welfare of Japan and Chair of the 72nd Regional Committee, Honorable Ministers and Heads of Delegation, Dr. Takeshi Kasai, Regional Director for the WHO Western Pacific Region, dear colleagues. It is a pleasure to be able to address the Western Pacific Regional Committee, and I am sorry that I cannot be there with you in person. Public health agencies and governments around the world continue to face enormous challenges as the COVID-19 pandemic evolves. The emergence of new SARS-CoV-2 variants, inequitable rollout of vaccines, and increased social mixing and travel are just some of the challenges that we must manage and face going forward. In the Western Pacific region, many countries have performed incredible public health work, avoiding the large explosive outbreaks of SARS-CoV-2 that other regions have experienced. However, this success also presents new and complex challenges, with the global epidemiologic context of vastly different levels of population immunity and residual risks that remain. The COVID-19 pandemic has been a stark demonstration of how important it is that we invest adequately in public health. During the World Health Assembly in May this year, all member states spoke about the need to have stronger public health surveillance systems on a global basis. Collectively, we need to be able to identify public health risks as quickly as possible and mitigate those risks wherever they occur and whatever the nature of those risks. We have to have far greater capacity to conduct intra-epidemic and intra-pandemic monitoring to understand how our control measures are working and how pathogens are evolving. We need better forecasts to anticipate where risks may occur and what the impacts may be. We need to improve decision support tools so that leaders can take the best decisions based on sound analysis. And perhaps most challenging of all, we need a new global data ecosystem that enables insights from data to be shared much more freely and quickly, integrating crucial contextual data such as weather, travel, animal health, public sentiment, and many other aspects. To address these challenges, WHO has established a new WHO hub for pandemic and epidemic intelligence. The focus of the hub is to strengthen pandemic and epidemic intelligence through better data, better analytics, and better decisions. The WHO hub will accelerate implementation of some existing initiatives, such as the Epidemic Intelligence from Open Sources, EIOS, and sentiment analysis for infodemic management. And it will also innovate in new and evolving areas such as the analysis of large-scale genomic databases and the development of a semantic web of knowledge that links diverse data from multiple sources. The establishment of the WHO Hub has received strong support from the federal government of Germany, which has committed $100 million for the next 3 years. Building our joint capacities to detect and understand future risks, whenever and wherever they occur, will require us to strengthen our existing collaborations and build new ones. I'm particularly grateful for the excellent collaborations that we have had with all the member states in the Western Pacific region, which I regard as a leader in public health surveillance. I am also personally grateful for the important leadership of Dr. Kasai, who over many years has been one of the public health's greatest innovators and who has been a strong supporter of the development of the WHO Hub for Pandemic and Epidemic Intelligence. I look forward to providing you with further updates about the WHO Hub and to working with you together in the coming years on this incredible initiative.
Thank you very much, Dr. Ryan. So the regional committee members and the working group co-chairs are here. So the questions and comments to them will be entertained now. So we will entertain questions and comments to them. If you are in this room, please push the microphone and then take the floor. But if you are participating through the Zoom, please use this hand-raising function, the Zoom, if you are remotely participating. So please cooperate with us in that procedure. Thank you. So now floor is open to entertain questions and comments. Now Cambodia, please. Cambodia, please. Cambodia, please. Could you please take the floor? Cambodia, please.
Please tell them it's not. Sorry, chairperson, it is not this one. Sorry. For item 7.
Now, New Zealand, please. New Zealand, please.
Thank you, Mr. Chair, Regional Directors, Ministers, colleagues, tēnā koutou katoa. New Zealand welcomes the report of the Regional Director, Dr. Kasai, and thanks the Western Pacific Regional Office for your efforts to advocate for the health and priorities of our region this past year. We're heartened with the ongoing commitment for the future, and our collective vision for the Western Pacific can be the safest and healthiest region in the world. We acknowledge WIPRO's dedicated efforts in reviewing our progress towards this vision. As we have seen in the past 2 years, the thematic priorities for the future have not been pushed aside by the pandemic. Rather, the need for urgent action in these areas has been amplified. Now is the time to harness the lessons learned from our domestic, regional and global COVID-19 responses to enact concrete changes in the management of inequities, of NCDs, health security and climate change. More than anything, COVID-19 has shown us that health is an essential infrastructure, not a cost. And in order to really be the safest and healthiest region, we must continue to address the determinants of health. While these determinants are broadly similar, they take a different shape across the highly varied countries in our region. And we should applaud the regional office for its country-centered approach, which is particularly important for smaller member states, including Pacific Islands, who are often disproportionately vulnerable to health threats. Further, in the context of COVID-19, we agree with the Regional Director that strengthening our national and subnational response capacity will be critical to health security and preparedness now and in the future. As the Director General Tedros has stated, we are not safe until everyone is safe. New Zealand has not been spared the significant surge in COVID-19 that the region has experienced in 2021. To date, we have pursued an elimination strategy to stamp out and reduce the risk of the virus to our country. However, we're now in the throes of an outbreak of the Delta variant in some parts of the country, and this highlights the importance of equitable COVID-19 responses to ensure the tools we have developed to fight COVID-19 work for the hardest to reach in our communities, as well in the New Zealand context, Māori and Pacifica peoples. Like many other countries in the region, we're rapidly scaling up our COVID-19 vaccine rollout to address the current outbreak, as well as to prepare for reconnecting New Zealand to the world early next year. We're hoping to have a high vaccination rates, and we know there will still be risks to our population and of course to the health system. We look forward to learning from others and also stand ready to share our thinking and experience with others as we negotiate these changes, particularly with those countries that are also working towards reopening. Finally, I wish to conclude by sharing a message in the language of the Indigenous people of New Zealand, the Māori. Ma whero, ma pango, ka oti ai te mahi. Through cooperation and combined efforts, our work will be completed. Thank you.
Thank you very much, New Zealand. Next is Japan, please.
Thank you, Chair, State Minister Yamamoto. Japan would like to express our deepest gratitude for the co-chairs, Ambassador Grata and Mr. Colin McKiff, for their dedication and their tireless efforts to bring together a wide range of views from member states in a limited time period to move important discussions of WGPR forward. We also thank Singapore for representing the Western Pacific region in the Bureau. Japan will continue to actively participate in this working group. We have two questions. First, it is to our understanding that the Secretariat is scheduled to submit a zero draft of the report for the special session of WHA today, October 25th, which we look forward to, which member states are expected to draft at the fourth session. As we mentioned at the third session, since this report would contain many important contents, we strongly hope that the text negotiations will continue after the fourth session in order to reach a firm consensus among member states. With this regard, what is the Secretariat's plan on the drafting process? Second, we have a question for Dr. Kasai. In this working group, one of the discussions between member states have been about making amendments to the IHR in order to establish a global intermediate health alert to trigger necessary action by state parties and WHO to respond to events that may not constitute a fake, but do require action when facing a potential pandemic threat. In this regard, some member states propose to enable WHO regional directors to propose a regional intermediate health alert, which would encourage prompt communication from the field, enabling transparency, timeliness, regionality, and flexibility of response measures. While Japan recognizes the benefit of such intermediate alert at the regional level, a respiratory infection due to a pathogen like COVID-19 spreads so quickly that there may not be enough time between the activation of a regional alert and the global alert, which is the fake. We believe France has asked a similar question during the last working group, but in what respects do you think the region should take a more leading role in the legal framework for health crisis management? We would like to hear your thoughts in light of the characteristics of the UPRO region, which has many island states. Thank you, Chair, and we look forward to see you all at the deep dive tonight. Thank you.
はい、ありがとうございます。
Thank you very much. The answers will be given later on. We'd like to hear the view from the USA, please. The next speaker is from the USA, please.
Thank you, Honorable Minister Yamamoto. And as this is the first time I'm taking the floor, I would like to congratulate you on your election as chair. The United States recognizes WIPRO's tireless efforts to support the region throughout this pandemic. COVID-19 continues to demonstrate in the starkest manner that no nation can combat a pandemic alone. Multilateralism and global cooperation are crucial to prepare for, respond to, and recover from global health threats. In this context, we acknowledge the importance of building on the technical work of the Third Asian Pacific Strategy for Emerging Diseases, APSID-3. The United States appreciates the leadership of so many countries that have rallied toward the global response and the diverse challenges facing countries and areas in the WIPRO region. We have dramatically expanded our global efforts to fight the pandemic, and we're committed to doing so in close partnership with WHO. The United States also appreciates the work we're all engaging in together through the Member State Working Group on strengthening WHO preparedness and response to health emergencies, and has carefully listened to Member States' interventions and proposals over the last few months. And I would also like to thank our co-chairs, Ambassador Grata and Mr. Colin McGiff, and our regional WIPRO representative, Dr. James. The United States has put forward 3 proposals for member state consideration at the WGPR. One on targeted amendments to the international health regulations, which could address critical gaps and focus on relevant articles without renegotiation of the entire instrument. A second on governance, where we're also proposing the creation of 2 standing committees to increase member state visibility into WHO processes and facilitate more informed, timely decisions by member states through the governing bodies. And third, on equity, another important area of work that must be addressed through WHO strengthening. COVID-19 has underscored the inequity in our global health response and widespread disparities that hamper access to healthcare generally, but more specifically to diagnostics, therapeutics, vaccines, and other critical health response products. These are complex and challenging issues, and it will be time-consuming to build bottom-up member state consensus. We must also build consensus across stakeholders. WHO member states alone cannot agree to, or importantly, implement measures that impact such a wide range of society alone. The WGPR has only 3 days left of formal meetings to come to agreement on its recommendations to provide to the WHO special session, and undertaking strong and ambitious intersessional work is focused on a steady progress is critical. We must start to narrow our differences in a meaningful way to put this collective effort and the World Health Organization on a path to success. We look forward to continuing this work together, as failure to undertake this work will be viewed by the world as an abdication of our duty. I thank you, and I thank our co-chairs.
Thank you very much. Next, Vietnam, please take the floor.
Respectable WHO Director Citizen, Respectable WHO Region Director for the Western Pacific, Dr. Takeshi Kansai, Chairperson, Honorable Hand Minister, ladies and gentlemen. Vietnam would like to congratulate the excellent addresses by the Director Citizen and the Regional Director, as well as the magnificent report on the work of WHO in the Western Pacific region from July 2020 to June 2021. As we all acknowledge that the COVID-19 pandemic is a global human tragedy that not only threatens the health of our population, but also challenges our society, economy, and culture, and that require all member states and international community to stand in solidarity in the fight against this common enemy. Vietnam highly appreciates the technical support of WHO Western Pacific region for prevention and control of the COVID-19 disease in the region so far by timely provision of emergent recommendation and technical guideline organization of a variety of virtual meetings and conferences for member states to share information and experience in combating COVID-19. In addition, the WHO region office has played an important role in coordination of vaccine distribution to COVAX facility. It is our pleasure to say that under the strong leadership of the government and with financial and technical support of the WHO Regional Office for the Western Pacific and other international development partners, Vietnam has current success in controlling the COVID-19 outbreak while maintaining social, economic stability with the consistent goal to achieve the objective of economic development and epidemic control and move toward safe, flexible, and effective control of the COVID-19 pandemic. COVID-19 pandemic has created challenges for all member states to review their core capacity as required by the ISR 2005, including policy, surveillance, risk assessment, laboratory, infection prevention and control, clinical management, risk communication, contact tracing, and resources. So as to recommend those should be continually strengthened using the Asia Pacific strategy for emerging diseases and public health emergency as guidance in the coming time. On this occasion, Vietnam would like to report its main achievement toward responding to NCD threat, especially with the complicated development of COVID-19 pandemic this year. Vietnam has taken intensive action and gained significant results, continuing to implement to the NCD national strategy. Vietnam developed the National Action Plan for Prevention and Control of NCD for the period 2021-2025 that includes mental health, and it has been submitted to the Prime Minister for approval. I hope that through concerted effort to implement the comprehensive priority for attainment of sustainable development governed by all member states of the region, and with the strong support of WHO, the health of our people will be more and more improved, and our region will become the safest and healthiest one in the world. Lastly, we would to take this opportunity to thank WHO for the support, and I do hope that the cooperation between WHO and all member states in the region and Vietnam in particular will be further strengthened in the future. Thank you.
はい、大変に発言、質問ありがとうございました。
Thank you very much for your comments and questions. For these questions, Dr. James or the working group joint chairperson and the regional director, would you like to answer? Please answer these questions.
Sure, Chairperson, thanks. Maybe I can start for us. And thank you so much to the delegations who spoke, and appreciate all the support and the goodwill and the work together. I'll be honest, it is definitely a lot of work, and but it's very, very well worth it. And in fact, the contributions, again, as my co-chair said, from the Western Pacific region have been so valuable, and many times have helped us kind of think a way through. I want to respond in particular to some of the comments from the delegation from Japan, just to assure that there absolutely will be full opportunity to negotiate. Our intention is to go as far as we can with the formal meeting on November 1st to 3rd, but that if there are informals, we've already begun, in fact, working with the Secretariat to identify times and dates that informals could take place. I think one of the values, and you're seeing, colleagues, you're all seeing this right now. I mean, there are many, many downsides to this virtual environment. And I think, in fact, we do need, I can't wait till we can get together to negotiate in person, because I think that's where so much good, compromise and consensus can be reached. But the benefits of this virtual environment are that we do have, as you see on the screen with the Bureau members, Dr. James is very active and involved in her country's response and is leading from the Western Pacific region. I'm capital based as well here in Washington, though I've been was posted in Geneva previously, and Ambassador Grata is posted in Geneva and was in New York. And so we have a mix of the diplomatic and the technical, and that's frankly what we need in this case. And so we are going to take as much time as we need and create as much space as we can for you all to find that consensus. I think what you'll see when you see the zero draft as well is that we've tried, especially in that way forward part, we've heard member states loud and clear that there's not a comfort for the Bureau to do the drafting ourselves, and that's wonderful. Actually, it's very good for the member states to take that themselves and to lead that, and we will, as we have been, we'll continue to facilitate. But what we've done with this report is to set it up in such a way so that I think it's possible to be taken, some of the recommendations and ways forward, if they're agreeable to everyone, can be adapted fairly quickly, I think, to a decision and to an outcome for the special session in November. So I'll stop there. And again, thank you to all the delegations who have spoken and have contributed to this process so far.
Thank you, Co-Chair. If I just may add what my Co-Chair, Mr. McKeith, has already said. Yes, indeed, we formally plan that the fourth working group will be the last formal meeting that we have to discuss the report. But of course, this is pending the result of the meeting on the fourth meeting. But for that, we already work with the Secretariat to find available time for us to continue our work if needed and if guided by member state. And just again to mention to refer to the proposal made by the US. This is something that we already acknowledge as the co-chair, but again, it will up to the member state to decide how they will carry forward and discuss the proposal. I believe that all proposals coming from member state are something that are valuable for to further our working to enrich the discussion within the working group. So it is up to member state how they will going to carry the discussion forward. Thank you.
Thank you very much, Chairperson. And taking this opportunity, I wanted to thank Dr. Lynn James for representing our region. Really, thank you very much. And the two co-chairs, Colin and then Excellency Ambassador, I haven't met you, but I'm looking forward to see you at some point. My position is to serve as a secretariat. So this working group, I really wanted to listen very carefully and see how and then where it goes. And I wanted to commit outcome I'm in a position to implement. But I wanted to share my experience in the past. The global discussions, global solutions can be effective if all member states participate in discussions. And I wanted to really encourage all the member states to participate as much as possible in these discussions. The other point is that global health consists of the global solutions, but that global solutions can be maximized if it's synchronized with the national and subnational effort. And so when you participate, please make your positions very clear, and you can fully utilize your experience observations of COVID-19 in contributing to these global discussions. I think we wanted to have a very practical output, which helps us to be ready for the next pandemic. So I'm very much looking for that kind of situations. And thank you very much, Japan, for your question. Actually, I received the same questions during the working group presentation, which I was not expecting. Again, my position is the same. I look forward the outcome of the discussions. But let me share our principle of the upset implementation, which is to make everybody connected. So within WHO, we're trying to connect with the regions and country office, regions to headquarters, so the 3 layers to be connected. And then at the country office level, we're trying to make sure that our country office to be connected with the member states who we're serving. And also helping member states, the national level, to be connected to the subnational level and to down to the village. So if something occurs at the front line, this information will come as quick as possible. And we have already established a system since SARS to monitor the event in these regions. And every day, around 270 some rumors were verifying, down to 70 and down to 2 to 3. And I very much appreciate the member states' collaborations. Whenever we verified, we got quickly the feedback about that information. And these are the kind of things can be a basis for further discussion, what level, what kind of warning we need as a systems around the world. And I'm very much looking for the outcome of the working groups. Thank you very much, Chair.
はい、活発な議論ありがとうございました。
Thank you very much for the active discussion. Dr. James, any comment at this point?
Just like to reiterate my thanks to the member states of the Western Pacific region who have really participated actively in the process and with very valuable contributions. And so, I look forward to the continued support and participation, especially for our 4th working group, and we hope to be able to finalize it, the draft report to be presented to the World Health Assembly special session. And I'd like to reiterate our co-chairs' assurance that really this report will be a consensus document from all member states. Thank you.
共同議長に関しましても感謝を申し上げる次第。
Well, my thanks goes to everyone. So with respect to the discussion on this agenda item, we'd like to close that. Thank you very much indeed. Next, we'd like to move on to agenda item 7. Go back to agenda item 7. In the morning, we had address by the RD, and we would like to discuss that. And so we would like to receive interventions. So, China, please.
Thank you, Mr. Chair. Your Excellency, Dr. Kasai, ministers and colleagues. The Chinese delegation would like to thank RD for his annual work report, especially the updates on and response to COVID-19 in the region. This region has attached abiding importance to the prevention and control of emerging infectious diseases, thus laid a good foundation for national responses to the pandemic. In RD's report, we note the active measures taken by the region to assist the member states in vaccine access and pandemic response. At the same time, concurrent efforts have been taken to promote inter alia disease control, health system services, aging, environmental health, and health innovation. Progress has been made in all these areas. COVID-19 has been the most devastating pandemic that hit the world in the past century. Since mid-May, China has successfully contained a number of local cluster cases that were related to the Delta variant. In its response to the pandemic, China has always been putting people first and putting life first. We've been upholding early detection, early reporting, early quarantine, early treatment, pooling resources for free treatment, respecting the value and dignity of each and every life. We have all along been scientific and precise in our measures and have made cross-sectoral plans for both pandemic control and socio-economic development. We've made scientific and precise ongoing efforts to curb COVID-19 and have promptly and resolutely stamped local cluster cases, established a medium and long-term mechanism coordinating pandemic response and socio-economic development to minimize the fallout of the pandemic and bolster the safe, orderly, and sustainable socio-economic development. We've provided anti-pandemic supplies to help the globe respond to the pandemic. Large quantities of supplies have been provided to the international community, and teams of medical experts have been deployed. More than 100 countries and international organizations have received more than 100 million doses of vaccines. We've actively organized technical exchanges to share China's experiences. On the same day, 50 years ago, the People's Republic of China resumed its legitimate seat at the UN. Over the past 50 years, China has been a staunch advocate of multilateralism, and we have been supporting robustly WHO's leading role in coordinating global response. China will robustly implement the Global Development Initiative put forward by President Xi Jinping at the general debate of the 76th UNGA and continue to deepen international cooperation in fighting the pandemic, have a holistic response to the pandemic, and make a good balance between socio-economic development and pandemic response. We will work along with international community to safeguard global public health security and jointly promote the building of a global community of health for all. Thank you, Mr. Chair.
ありがとうございます。
Thank you.
それでは続い
Next, I would like to invite Malaysia. Malaysia, please go ahead.
Malaysia would like to thank the government of Japan for bringing us all together and hosting this meeting. Malaysia wishes to also commend Dr. Kasai for his persistent and resilient leadership in navigating the Western Pacific region through these uncharted waters. Like many other countries, Malaysia rolled out our COVID vaccination program for the adult population in phases, starting with priority groups like healthcare workers and the most vulnerable. Today, 90% of our adult population are fully vaccinated, and 80% of adolescents have received at least one dose. Malaysia ensures that we practice a no wrong door policy, so everyone gets access to vaccine, regardless of their citizenship or documentation status, including refugees and the stateless. No one is safe until everyone is safe. Malaysia feels vaccine inequity has been one of the greatest moral failings in humanity's collective response to the pandemic. When the world was told vaccines would be available, there was great hope for global solidarity with the establishment of the COVAX facility. Yet to date, its delivery has been far short of what was planned. It has been in large part a great disappointment, with bilateral deals taking precedence over international collaboration and global solidarity. Malaysia calls on this inequity to be addressed immediately, with more equitable distribution, dose delivery swapping, in which Malaysia is willing to participate, and technology transfer and investments to manufacture vaccines in many more sites around the world. We hope this inequity will not repeat itself with the latest antiviral treatments that are being developed and COVID vaccines for children. Malaysia suggests WHO moves towards a new equitable plan of distribution for antivirals and COVID vaccines for children. We are reminded of what Einstein said about trying the same thing again and expecting a different result. We would like to support the call by the WHO DG for an international agreement on pandemic response. But this agreement must not just be inclusive and accountable, but it must also be equitable and transparent. Inclusive may mean we were invited for a conversation, but equitable means we all enjoy the fruits of the discussion in timely and equitable measure. Accountable may mean we are all represented here, but transparent means we have sight on all deliverables, deals, and data. Understanding the importance of transparent and real-time sharing of data, Malaysia uploads comprehensive data sets daily for anyone to access. We upload individual anonymized line-listed details of every positive case on a daily basis. Malaysia's data is submitted to GitHub in the spirit of open data, so other countries can see real-world data on vaccine effectiveness, breakthrough infections, and deaths based on vaccine type, when the vaccines were administered, and other key anonymized personal data like age and underlying health conditions. We also need to share with and empower one another with best practices in the use of technology. Many of us have developed applications using artificial intelligence for contact tracing, quarantine facilitation, digital proof of vaccinations and testing. Malaysia has our MySejahtera application that has been a ubiquitous public health tool during the pandemic. Many other states have developed their own. This is a relatively low-hanging fruit for the best elements of our technological response to be curated, integrated, and white-labeled for any country that may want to adopt such technologies. Finally, Malaysia would like to raise the silent parallel pandemic. This is the deterioration of mental health, especially among young people. Lockdowns, movement restrictions, together with unemployment and financial insecurity, have led to a spike in the number of people seeking mental health support across the globe. Malaysia is no exception. In conjunction with the Mental Health Day this year, Malaysia launched our strategic plan for mental health, highlighting intersectoral collaboration and crisis preparedness in addressing mental health issues, including suicide and suicidal behaviors, as well as surveillance for early detection of cases that will allow for prompt monitoring and timely intervention. I wish to reiterate the importance of mental health as it inevitably affects physical health, and it is vital for us to share this message to the public to raise awareness. Being part of this region, Malaysia is confident that the enduring cooperation and concerted efforts undertaken by our nations will see us through this crisis together. Arigatou gozaimasu. Thank you very much.
はい、ありがとうございました。
Thank you very much. Now the next is Australia. Australia, please.
Thank you, Chair. I'd like to begin by thanking Japan for hosting the 72nd Western Pacific Regional Committee meeting. We are pleased to be able to participate both in person and virtually as per the hybrid format. The Regional Committee meeting offers a unique opportunity for us to discuss our regional specific context in addressing COVID as well as persisting health challenges. We thank the Regional Director and the Regional Office for all their hard work since the start of the pandemic in shaping outcomes for the future, and we look forward to the important exchange on discussions throughout the week. The WHO's wide-ranging support to the Pacific Island nations has been critical to the COVID-19 response, deploying COVID-19 vaccines and treatments, combating vaccine hesitancy, and sustaining basic health services. Vaccination remains a key element in reducing the impact of COVID-19 in the region. Australia is playing our part and will supply 60 million doses to Southeast Asia and the Pacific by the end of 2022. Australia has also committed 130 million through the COVAX facility's advanced market commitment, which has distributed over 86 million doses to Southeast Asia and the Pacific. We must continue to support initiatives such as the ACT-A and COVAX facility as models of effective response to health emergencies. Australia recognises the delicate balance between border closures to limit the transmission of COVID-19 and the importance of re-establishing travel that is critical to trade and tourism. Australia has introduced an international COVID-19 vaccine certificate for outbound travellers, which meets the new global standards specified by the International Civil Aviation Organisation and conforms to guidance from the WHO. It provides a credential that other countries can respect and trust. And we are steadily progressing through our plan to reopen our economy and our borders when it is safe to do so. It is critical that we continue to establish and strengthen laboratory capacity throughout the region. Whole genome sequencing is vital for early response to emerging COVID-19 hotspots, and where possible, Australia will continue to offer support to the region. Throughout the COVID-19 pandemic, Australia has offered specialist pathology expertise to the region through provision of testing and sequencing search services, in-country support, and expertise on circulating and emerging variants. COVID-19 has clearly shown that the World Health System must evolve to be better placed to respond to future health emergencies. Rapid information exchange has been critical for the response to COVID-19, and we must take opportunities to improve exchange of information to allow swift response in the region. Australia supports further collaboration between the WHO, the OIE, the FAO and the UNEP to increase One Health surveillance capacity. We should also continue to increase investments to strengthen regional health systems and not lose sight of our other long-term health goals such as polio, tuberculosis and malaria, which persist as significant health concerns. Australia remains committed to taking forward the reform agenda, including by continuing to engage in the working group on strengthening WHO preparedness and response to health emergencies. We also remain committed to progressing outcomes from the upcoming WA special session, including those related to the proposed pandemic instrument and potential strengthening of international health regulations. We welcome continued detailed considerations of these and other reform priorities in the lead up to the 150th meeting of the Executive Board. Finally, Australia supports the concept note planning for endemic COVID-19 and beyond. Thank you, Chair.
はい、ありがとうございまし
Thank you
た。
very much, Australia. The next speaker is Laos. Please, Laos, please take the floor.
Honorable Chairman, it is a great honor for me to address to the 72nd session of the Regional Committee for Western Pacific, which is held here today in Himeji, Japan. Investment for the last 15 years in preparedness for health security threat under the Asia-Pacific Strategy for Emerging Diseases and Public Health Emergency have improved Laopedia readiness in responding to COVID-19. Throughout the pandemic, we have reviewed and refined our response to COVID-19 to adapt the rapidly evolving situation. Though it has challenged our health system, COVID-19 has also provided us the opportunity to further strengthen our capacity and to rapidly respond to health security threats and enhance a resilient health system for COVID-19 and beyond. Multi-sectoral cooperation and coordination within the government, the private sector, the development partners, and importantly, engagement of the community have contributed to Laopedia to date responding to the pandemic relatively well. While responding to the pandemic, we made a great effort to sustain essential health services, including routine immunization, mother and child health services, and communicable disease prevention and control. We also used COVID-19 as an opportunity to strengthen local governance ownership for improving primary health care. Further, there have been progress in development of the health financing strategy, which provides strategic direction on sustainable health financing in the context of COVID-19, and donor transition and improving health information system on surveillance and vaccination, but also to hospital autonomy in long term. But we know that our work has to continue and that we must remain vigilant. Laopedia is currently facing its most challenging time since the start of the pandemic. Community transmission is occurring in many provinces. However, our systems are stronger. We have fully vaccinated 37% of eligible population, which aim to accelerate vaccination to reach more than 50% by the end of 2021, especially to eligible and vulnerable population in hard-to-reach areas. I thank you very much, Mr. Chair.
Thank you very much. Next speaker is Cambodia, please. Cambodia is the next speaker, please.
Honorable Hiroshi Yamamoto, State Minister of Japan, Chairman of the 72nd Regional Committee for Western Pacific meeting. Honorable Dr. Takashi Kasai, Individual Regional Director for the Western Pacific Regions. Honorable Minister, Representative of Mobile State, distinguished guests, ladies and gentlemen. Firstly, I commend the significant achievement over the past year under the Dr. Kasai leadership and the individual team. Cambodia's support for the future vision, which member states endorsed 2 years ago and remain relevant to guide our works. Cambodia is a small country, why a big heart. Last year, Cambodia has successfully managed the COVID-19 response with less than 500 cases and no deaths. Under the brilliant leadership of Samdech Akak Mahasenapadai Dato' Hun Sen, the Prime Minister of the Kingdom of Cambodia, and strong support from all sectors and communities, Cambodia continues to put COVID-19 response under control. Like many other countries, the virus is still circulating in Cambodia. We are making every effort and suppressing the virus transmission along with implementation of 3 Ds and 3 Don'ts. We are now at the stage of adjusting of our COVID-19 response strategies in order to learn how to live with the virus while allowing reopening the school and the economic safely. I would like to share the 4 important factors contributing to success in our response. First, decisive leadership and the whole of government's approach. Second, investment in health security and health system. Third, public participation, communities, and individual engagements. And lastly, solidarities and partnership. For the national vaccination campaign, COVID-19, vaccinations are now being ramped up with our ambitious to vaccinate Cambodians from 6 years of age and over following the blossom flower strategies of our Samdech Akak Mahasenapadai Dato' Hun Sen, Prime Minister of the Kingdom of Cambodia. As of 24 October 2021, 85.36% of Cambodia of the total 16 million target population have been vaccinated. Last but not least, ending this pandemic is our common goal. Solidarity and cooperation are a must. Cambodia is working together with countries, world organizations, and partners for a better future toward the healthiest and safest world. Cambodia fully supports the virtual leadership and coordination and the global response to COVID-19. We look forward to advancing our journey toward a better future for us all. Thank you very much.
はい、ありがとうございます。それでは
Thank you very much. Then Japan, please.
Chair, honorable ministers and delegates, Dr. Kasai, Regional Director, WHO Regional Office for the Western Pacific, and ladies and gentlemen, I wish to add my voice in welcoming the 72nd Regional Committee meeting in Japan. Personally, it is the 4th RCM hosted by Japan. That shows how old, how young I am. But this RCM is very special for us because we are celebrating 70 years after joining WHO on 16th of May, 1951, 2 days before first RCM that was held in Geneva and decided the location of Secretariat, Manila. Chair, Japan welcomes RDM address and his 3rd annual report. We also thank the COVID-19 updates. They very well illustrate the challenging circumstances, notably the COVID-19 pandemic. And at the same time, they describe our joint effort to make our region healthier and safer. It is evident that Dr. Kasai had led the WHO's regional office very competently and addressed this region's health challenge and crisis. Chair, I have 3 points. First, COVID-19. The COVID-19 is a naughty virus to attack the weakest point of each country. However, the mortality and morbidity in our region have remained relatively low compared with other regions. I see this is the joint outcome of member states and the regional office headed by Dr. Kasai. He himself a veteran fighter against emerging infections. Through COVID-19 tsunami, Japan learned 2 lessons. One is the need to review our system and mitigate our issue in resilience to the new challenge. We learned that no single measure is sufficient to manage this epidemic. And we realized that our proud UHC system has issues in surge capacity in emerging settings. My second point is the importance of international collaboration. For most Japanese, global health was an issue for somebody else. But we suddenly became the situation where there is no vaccines, no drugs, and health system is nearly collapsed. Now international health is not their problem, but our problem. That is an important lesson we learned. We are keen to learn best practice in fellow member states in this region. I understand that this is a bottom-up approach, and this is a legacy approach adopted by Dr. Kasai, and we strongly support it. Regarding the needed health technologies and the products, in addition to expanding collaboration with COVAX facilities, as Minister Goto mentioned in his address this morning, we have started an aggressive program in our new vaccine and drug development that should be helpful for everyone. Chair, my last point is for the future. There have been many challenges in the past, but our engagement with WHO is never changing and indeed enhanced. Dr. Kasai has every reason to be optimistic. When we are accepted as a new member of WHO, then Health Minister Kurokawa made the following speech, quote, "The Japanese people are eager to gain a place in the family of nations by collaborating in every field with the peace-loving nations. We pledge ourselves, we shall faithfully abide by all duties and obligations deriving from the Constitution of the WHO," unquote. The preamble of the Constitution is still very valid. We all know that definition of health, but following line is also important. Let me quote, "Unequal development and the control of disease, especially communicable diseases, is a common danger," unquote. Chair, it is time for us to move forward together with the able leadership of Dr. Kasai. We hope this 72nd session of RCM, under your leadership, Chair, opens the door for the new generation of collaboration in this region. I thank you, sir.
はい、ありがとうございます。
Thank you very much. Moving on, we'd like to invite Hong Kong. 地域事務局長の笠井様、大臣、メンバーの皆様、中国、香港を代表して、
organizing the 72 session of the World Health Organization Regional Committee. And I would also like to thank Japan for hosting this year's meeting for the Western Pacific region, for member states to share their experience and to exchange views in various health-related issues, in particular, the tackling of the COVID-19 pandemic. I'm honored to provide an update for the COVID-19 situation in Hong Kong. Since the outbreak of the COVID-19 pandemic, the Hong Kong Special Administrative Region government has implemented various anti-epidemic measures using an evidence-based approach, including border control measures, social distancing, testing, contact tracing, quarantine, and isolation measures, as well as our community-wide vaccination program. The Hong Kong SAR government has responded promptly and also successfully to our 4 waves of epidemics so far with the above measures. It is encouraging to see that Hong Kong has no local cases with unknown sources of infection for most of the days in the past few months and has basically achieved 0 infection. As the epidemic situation in Hong Kong continues to remain stable, we have adopted a new direction in fighting the epidemic since April by adjusting various epidemic measures with vaccine bubble as the basis, with a view to restoring our city to normality in a gradual and orderly manner. With the emergence of more transmissible variants of concern, cases carrying L452R mutation and N501Y mutation were also detected in Hong Kong. As the global pandemic situation is still under serious threat from mutant strains, we will continue to stay vigilant to cope with the next wave of COVID-19 epidemic. Towards this end, we will consolidate experience gained, strengthen our current capacities, and map out targeted and refined strategies. Looking forward, it is important for the Hong Kong SAR and the wider international community to continue to press ahead with large-scale vaccination for the general public, particularly the elderly, in order to build a protective barrier for the entire community. Since the rollout of the government vaccination program in Hong Kong in February, the Hong Kong SAR government and different sectors in the community have introduced various measures and reward programs to encourage members of the public to get vaccinated as soon as possible. As at today, over 8.9 million doses of vaccines were administered under the program, with over 68% of the eligible population have received at least 1 dose of vaccine. The World Health Organization has indicated repeatedly that no less than a global effort is required to end a pandemic, and no one is safe until everyone is safe. As a global citizen, Hong Kong reaffirms the importance of international cooperation in fighting the COVID-19 together. An example of this is the Hong Kong SAR government's early announcement this month of its donation of 7.5 million doses of AstraZeneca COVID-19 vaccines to the COVAX facility, benefiting the low-income or lower middle-income COVAX advanced market commitment eligible economies. Before I end, I must thank the member states in the Western Pacific region and the WHO Regional Office for the Western Pacific for the continuous and also close cooperation with Hong Kong during this unprecedented difficult time. I also wish to express our highest esteem to the frontline healthcare providers around the world for their contribution and also sacrifice in keeping everybody safe. Hong Kong looks forward to the constructive exchange and also working closely with all of you in bringing the pandemic under control globally before long. Thank you very much.
はい、ありがとうございます。それではフィリピン国
Thank
お
you
願いい
very
たします。
much. Next, Philippines.
The Philippines congratulates the Japan State Minister of Health, Labor, and Welfare, the Honorable Yamamoto, for your election and assumption as chair of the 72nd session of the WHO Regional Committee for the Western Pacific. Kudos as well goes to R.D. Takeshi Kasai for his sterling leadership in putting together this very successful and innovative 72nd session, of which all of us have been invited to be a part of. The Philippines affirms that the Western Pacific region's for the future vision remains extremely relevant now that member states need to strengthen health systems and public health capacity to sustain adaptive health measures and to treat COVID-19 as an endemic disease, while ensuring preparedness against new variants with increased severity and impact. We acknowledge the necessity of financing preparedness and response at the national, regional, and global levels. There should be optimal financing of public common good, leveraging resources of the private sector, developing insurance solutions, and strengthening collaboration among all sectors, including between ministries of health and finance, in universal healthcare financing. In a spirit of solidarity, the Philippines is both a donor and a recipient to the COVAX facility, having contributed financially to Gavi and SAPI, and is also a donor and recipient to the Contingency Fund for Emergencies. We will also support initiatives to pool resources at the regional level for adverse events and vaccine procurement. To advance international health regulations implementation, we must design policies that will accelerate the implementation of a universal healthcare system and will expand strategic engagement with the public sector. And towards this goal, the proposed Philippine National Health Security Act will address the WHO Joint External Evaluation Team recommendations to enhance political commitment, engagement of all relevant sectors, and accountability at all levels. We must work together to ensure that every nation's health system has the capacity to cope with sudden surges and increases in the demand for the care of individuals with severe and critical COVID-19. The Philippines practices this through our sub-technical working group on COVID-19 surge. And this group monitors healthcare utilization so that we remain aware of the level of burden experienced by sub-national healthcare systems, which would in turn affect overall mortality rates in the region. The Philippines also supports the solidarity trials for vaccines in support of multilateral initiatives on vaccination as a key strategy in preventing the progression of disease severity and saving lives. We also believe that WHO's assistance would be valuable to workforce augmentation and provision of timely recommendations of the WHO Strategic Advisory Group of Experts would efficiently speed up the implementation of the varied approaches while maintaining a steady supply of vaccines. Through these, we do not only reduce the burden and pressures on the healthcare system, but also extend protection to our vulnerable populations. On this note, thank you once again, Mr. Chair.
Thank you. Next, South Korea, please.
Thank you, Chair. 안녕하세요. To tackle the pandemic as a team, the Western Pacific region has reset its priorities to identify activities that supported COVID-19 response efforts, quickly addressed the needs of the member states, and continually advance the further future vision. I would like to express my gratitude to Dr. Kasai and his team for all their hard work. The report of the regional director stated that while prioritizing activities and flexibly readjusting goals to respond to COVID-19, WHO decided to not implement or downsize some of the work plan activities in accordance with the outcomes of the risk assessment. It would be much appreciated if any progress on the delayed or downsized activities could also be shared. Regarding endemic COVID-19, Korea believes it is important that we take a phased approach. Noting the increasing vaccination rate, Korea has begun to ease the public health and social measures to gradually return to normalcy from this November. For such a phased approach to be taken in the Western Pacific region, it is vital that we receive detailed guidance from the regional office on easing prevention measures and situation monitoring. In particular, to realize the strategies of endemic COVID-19, a guideline on effective surveillance system will be needed. I'd also like to stress that long-term investment on UHC-based health systems should be under our priorities. The important role UHC and the resilient health system plays in pandemic preparedness and response, and the health and well-being of a region has been repeatedly emphasized. Therefore, lastly, I want to add that we also need to address the issue of vulnerable populations' access to healthcare. We need to ensure that economic downturns and reduction in healthcare services caused by COVID-19 will not hinder the vulnerable groups from getting the care they need. Thank you very much, Mr. Chair. 감사합니다.
Thank you. Next, Mongolia, please.
Thank you, Mr. Chair. Mr. Chair, Regional Director Dr. Kasai, Honorable Ministers of Health, distinguished delegates, and ladies and gentlemen. Mongolia would like to commend the work of the Western Pacific Regional Office and the Regional Director supporting the member states in the fight against the COVID-19 pandemic. In particular, we commend the work done in the critical areas of establishing and strengthening laboratory diagnostic capacity and enhancing strategic partnerships with governments, UN agencies, and global cooperation mechanisms, such as the Access to the COVID-19 Tools Accelerator and the COVAX facility to ensure countries have an equitable access to COVID-19 tests, treatments, and vaccines. Mr. Chair, Mongolia started reporting the first locally acquired cases of the COVID-19 in the middle of November 2020. At the time, we had a very limited testing capacity with only one tertiary level health facility in the capital city and another mobile laboratory conducting the real-time PCR testing. Since then, within a few months' time, additional PCR laboratories were established at regional hubs, as well as in each provincial general hospitals around the country, with the kind support from our international partners in health. In the process, the UNICEF and the WHO country office have played a crucial role as one UN team in resource mobilization and coordination efforts by many different stakeholders. And we thank all of them for their tremendous job done in saving lives from this devastating pandemic. Mr. Chair, despite the high coverage of vaccination, Mongolia continues to report on average 700 to 2,500 new cases each day, with 3,700 cases being the highest number reported so far in a single day. The June and September surges were contributed by many factors, including the spread of the variants of concern, early sign of vaccine optimism, and reopening of social and economic activities without enforcing strict public health and social measures. Unfortunately, the surges in cases prompted the health system to stretch its limit and open up additional hospital beds, as well as intermediary facilities where patients are admitted until they are allocated a hospital bed. While responding to the ongoing pandemic, the government of Mongolia has been working towards strengthening its health system capacity to be better prepared for and respond to the future health emergencies. One latest example is the newly launched project strengthening rapid epidemic response capacity of health system in Mongolia, under which regional and subnational laboratory capacities are being further expanded. Additionally, as reported in the regional director's report, with the support from the WHO, Mongolia has sent specialists from the National Center for Communicable Diseases to the National Institute of Infectious Disease of Japan for the training in conducting SARS-CoV-2 genome sequences, as well as bioinformatics procedures to analyze the obtained data. And we also expect the procurement of a next generation genome sequencer, also supported by WHO, to be completed soon. Mr. Chair, based on the lessons learned from the June and September surges, as well as the continuous learning throughout the pandemic, Mongolia recognizes the fact that there is a greater need for integrated approach in dealing with other health challenges we face both as a country and as a region. These include maternal and child health service delivery, addressing premature deaths from NCDs and injuries, in the attainment of the health-related sustainable development goals, and the prevention and control of communicable diseases. Concluding the address, Mongolia would like to thank all the strategic partners such as the United States, Japan, Republic of Korea, Canada, the People's Republic of China, European Union, and the multinational banking institutions such as the Asian Development Bank, the World Bank, for their generous and continuous financial support. Lastly, but definitely not the least, our special thanks goes to the UNICEF and WHO country offices for their technical support as well as policy guidance and directions. Thank you, Mr. Chair.
はい、ありがとうございます。続きまして、
Thank you very much. Next speaker is from Vanuatu. Vanuatu.
Thank you. Good afternoon, Chair. Good afternoon, Secretary. Good afternoon, honorable ministers and honorable participants of the 72 RCM. Vanuatu has been COVID-free with no local transmission since March 2020. Only 3 cases have been detected and contained in quarantine. However, we are aware that this may change. Although it has been beneficial for the health and safety of our population, it has affected our economy, especially with the impact on international tourism. Since the launch of the first version of the Health Sector Preparedness and Response Plan in March 2020, Vanuatu has been strengthening its capacity to prepare and respond in the area of command and coordination mechanisms, border measures, including quarantine and IPC, surveillance and contact tracing, case management and risk communication. Multiple multi-sectoral tabletop and live simulation exercises have been conducted to test and improve our plans, guidelines, SOPs, and processes to respond to COVID-19 outbreak. Vanuatu started COVID-19 vaccination in June 2021, and as of October 2021, about 20% of the adult population is fully vaccinated. 53% of healthcare workers and 23% of elderly over 55 years old. However, more needs to be done, and the Ministry of Health has set targets of 90% of eligible population to have received at least 1 dose of the vaccine by the end of 2021. It is expected that by the end of this year, 40% of the eligible population would be fully vaccinated. The Ministry of Health of the Republic of Vanuatu wishes to acknowledge WHO's technical and financial support over the last 19 months in preparing the country to respond to COVID-19 outbreak. And we express our thanks also to COVAX facility for making the vaccine available. We wish to congratulate health ministers as well as health workers around the Western Pacific region for their commitment and dedication to work diligently as one united force to combat COVID-19 and its disastrous effects on the well-being of our people. For Vanuatu, the delay of COVID-19 virus to enter, as well as local transmission, has given us ample chance to observe and to learn from you all to help us in our preparedness. Thank you, and I wish you all good, best wishes to everyone. Thank you.
Thank you very much. The next speaker is from Tonga, please. Next speaker is from Tonga.
Thank you, Honorable Chair, and congratulations on your appointment. First, I wish to acknowledge the courageous decision by the government of Japan to host the 72nd RCM. Maloi Lau Malie, honorable ministers and delegations, on behalf of His Majesty's government of the Kingdom of Tonga, I wish to thank you, Dr. Kasai, for your unwavering leadership during this very difficult time, depicted well in your report. We especially appreciate your passion and your support to the Pacific. Tonga remains COVID-19 free with increasing vaccination coverage. To date, more than 85% for first dose and 59% for second dose of the eligible population 18 years above. We just started last Thursday the vaccination of 12 to 17 years old and pregnant women with Pfizer vaccines from New Zealand. We are also strengthening COVID-19 response capacity, including lab capacity, contact tracing, and clinical management. Tonga welcomes the information document on COVID-19 in the Western Pacific region towards achieving high coverage alongside public and social measures with 5 key strategies. First, vaccine. For Tonga, the target is more than 70% of the total population to be fully vaccinated by December. Public health and social measures, this must be the new reality and new way of living, especially for Pacific population who often live in large families, often more than 10. If not, we cannot sustain the sacrifice we have done for about 2 years now. Third, improves system capacity. This cannot be done overnight and in 2 years. And to be realistic, it is work in progress for the small developing island nation. Early detection is related to strength of the healthcare system. So cautious approach given weak healthcare system is very important going forward. Tonga appreciates all partners' generosity, including Australia, New Zealand, Japan, China, and not only to prepare for COVID-19, but to strengthen our health system for the future. And of course, acknowledging the supports for vaccines from COVAX and the European Union. And of course, supporting primary healthcare strengthening. Tonga also appreciate collaboration with Pacific nations, including Fiji, Vanuatu, Solomon on repatriation flights. Finally, Tonga continues to call on the Tongan concept of tākanga e tauwhohe, collaboratively rowing the way during this very tough centennial pandemic journey, and particularly with the youth, so we can all reach our destination and the future we want, for a better future for our children and youth in the Western Pacific region. Malo aupito.
Thank you very much. The next is a speech from Fiji, please. Fiji. Fiji is the next speaker, please.
Thank you. We congratulate Japan for hosting the 72nd Regional Committee meeting. And we also congratulate my colleague, the chair of the meeting. Also, we'd like to thank the regional director and Dr. Kasai thank you for being steadfast and being the spine in the Western Pacific Office, overlooking the WHO Pacific Division. I'd like to thank them for supporting Fiji and also the Pacific Island countries throughout the difficult 18 months that we've been through in the region and also globally. Apart from responding to COVID-19, Fiji and other Pacific Island countries have had to deal also with the challenges in our normative work, dealing with issues such as non-communicable diseases, the other communicable diseases, and the challenges of vaccination hesitancy, climate change, and the nexus between climate change and health. Our response to COVID-19 and currently the outstanding vaccination program that we have in place would not have been possible without the support of our multilateral partners. And we thank Australia, New Zealand, India, USA, Korea, the United Kingdom, People's Republic of China, the European Union, the COVAX facility, and the UN agencies such as UNICEF, to name a few. To date, more than 96% of the targeted adult population have received their first dose, and 85% are fully vaccinated. We've now been able to ease the restrictions that have been in place with movements and containment areas lifted. Work has begun in earnest, and we look forward to our international border opening on the 1st of December and receiving tourists, which is so important to our economy. Fiji and Pacific Island countries are keen to continue to strengthen our health systems to be more resilient and absorb the shocks placed upon them. Every investment in a WHO or WHO Western Pacific program supports the health systems in Pacific Island countries. And that is so important. Therefore, I ask that these programs are so important that they should be continue to be supported, such as the Safe and Affordable Surgery Framework we agreed to last year. We need to see that these programs continue to progress because, as I've alluded to earlier, small island development states, Pacific Island countries, low middle income countries, these programs of WHO will support our health system strengthening. And this will be very beneficial to us. The pandemic has revealed that virtual tools and virtual training professional development programs is very possible. Fiji requests WHO and Western Pacific that we continue to explore training opportunities virtually so that our health professionals do not have to leave our shores. Because when they do, there's one less in the system. And as we all know, when they do leave our shores, attrition is always possible. The pandemic, Mr. Chair, has also shown us the importance of WHO emergency medical teams. We thank OSMED and New Zealand Med for supporting our local Fiji emergency medical assistance team. The principles of disaster response in EMTs are similar to the principle of surge responses through the pandemic. The strengthening of retrieval pathways and also the clinical care pathways that we develop. We ask WHO Western Pacific to support EMT development throughout Pacific Island countries and provide linkages for EMTs in the Western Pacific, not only for COVID or for the next pandemic, but also noting that the Pacific Island countries are prone to natural disasters. Before the pandemic, we had begun remodeling our health services to be more comprehensive and integrative. An important component was developing command centers. And did we know that during this pandemic, the remodeling framework aligned well with the IMT pathway? In responding to health system shocks, Fiji requests the WHO Western Pacific to support Pacific Island countries in having the capability to respond in a measured way and maintain some of the learnings from the IMT approach. COP26 begins in Glasgow soon, and Fiji and other Pacific Island countries will advocate for commitments. We ask WHO Western Pacific to support Fiji and Pacific Island countries to develop climate-resilient health systems and health facilities. In addition, our goal as a nation to have zero emissions by 2045. Mr. Chair, the pandemic has shown that what is needed is these words: partnership, collaboration, unity, respect, commitment, and diplomacy. I thank you, Mr. Chair.
Thank you very much.
I'm sure there are many more questions, many more comments, but it is time to close this session. We'd like to continue discussing this issue tomorrow morning. With this, we'd like to end today's session. Tomorrow at 9:30, we would like to resume the session, Japan time. In the afternoon, for those of you who will participate in Himeji, from 3:45, COVID-19 informal meeting will be held. Thank you very much. We'd like to meet all of you tomorrow.